What is going on, world? Welcome. Today is Monday, the 30th of October. So it's the day before Halloween. Hopefully everybody had a good weekend. If you guys are going to just now join us, my name is Kevin. I go by the Boot Nurse. We are going to be doing NCLEX questions. So I want to know who you are, where you're from, where you are at in your nursing journey. I know that probably nobody is on here right now because I literally just hit the button. So as you guys start to trickle in here, like I said, I want to know who you are, where you're from, where you're at in your nursing journey. We're going to be doing NCLEX questions. Hopefully everybody had a good weekend. I'll wait for everybody to start rolling in up in here. Hey, once we hit 100 people that are in the live, then I will turn this camera around away from my hideous face. So that way y'all can answer these questions. Yo, and I look kind of tired because I just took a nap and I am sleepy. So your boy's trying to wake up a little bit. But yeah, like I said, I want to know who you are, where you're from, and where you're at in your nursing journey. And if you're not a nurse, or if you're not on your nursing journey and you just so happen to stumble in my life, like what is your occupation? What brings you here? Some people just want to learn a little bit more. Some people just, they want to show up, nurses, and be like, oh my God, that's easy, or oh my God, that's dumb, or I really don't care. I don't care. But if you really got to come into somebody else's life to try to prove a point like that, then you got a problem. But, what do I know, right? But yeah. So it says, hi, I'm a flight medic from Maine. Shout out to you, flight medics. Okay. Trying to stay fresh and fit. Oh, fresh and learn more. Okay. I see you. I appreciate you being here. Also, make sure you guys like, share, and follow. Those are the three things that the TikTok algorithm loves, unless you pay TikTok money for like ads and sponsorship. And your boy's broke, so we don't do shit like that. But yeah, from Montego Bay, we always get Jamaica up in here. So I appreciate Jamaica for being here and being present. Suzanne says, I'm a mom who's debating on going into nursing. I'm a field medic. Okay. Shout out to you. Field medic, like in the Navy? Oh, I'm not in the Navy. Oh my God. Because Navy doesn't have field medics, but field medic in the Army, like, is that what you're talking about, Suzanne? And I'll just tell you, sometimes nursing isn't for everybody. Okay. It's an acquired taste, just like any other occupation or any other drive or want or passion that you have in life. So, most of the time, you really don't know if you like nursing until you become a nurse. And then after that, you feel like it's too late. But it's never too late for you to become a nurse or to change your occupation or to do something different within nursing. So former service, yes. Okay. Shout out to you. I'm a hospital corpsman in the Navy. I've been in the Navy for 16 years. So, shout out to you. Appreciate your service, because we all got it. We all got to do it. No, we don't all got to do it. But for those that do it, shout out to y'all. Y'all get an extra pair of love from me because, hey, I even got my little thing on today, where I worked at when I was an instructor. So I don't usually ever do that, but it's cold in Texas today for some ungodly reason. It's like 40 something degrees. It's just like, hey God, me again. Why? That's exactly how it is. So shout out to y'all. We got 106 people in here. I'm going to turn this thing around real quick so that way you guys can, not look at me and get these questions because that's what you guys are here for. So give me one sec. We got that thing turned around. All right. I'm pretty sure everybody can see that. Let me back it up, back up the truck. All right, here we go. All right, y'all. Welcome. My name is Kevin. We're going to be doing NCLEX questions today. Make sure you guys participate. I'm kind of funny sometimes. I'm a little sleepy, so I'm trying to wake up. So I appreciate y'all for, bearing with me a little bit while I start to wake up and bring that energy. Like I said, like, share, follow. That's what the TikTok algorithm loves. That's what I need in order to get it out to other people. Don't be selfish your whole life, all right? Make sure all three of those things happen. Don't troll my chat. You troll my chat, I'm going to ban that ass. Literally, it says, I'm going to ban that ass. So don't be that person being rude up in my chat, okay? I got these questions off nurselabs.com. I don't gatekeep. That's where I got them, nurselabs.com. I created an NCLEX course. It's in its pre-launch phase. You can get it for a lifetime for $48. That link is in my bio. If you need one-on-one coaching, that link is also in my bio. And at the end, we're going to do an Ask Me Anything. So, following the NCLEX questions. So if you guys want to hang around for that, we're going to be doing that. All right, here we go. There we go. Here we go. Question number 1. Nurse Jenny is instilling an otic solution or an otic solution into an adult male client's left ear. Nurse Jenny avoids doing which of the following as part of the procedure? Is it A, pulling the auricle backwards and upwards? It says warming the solution to warm temperature, placing the tip of the dropper on the edge of the ear canal, or placing the client in a sideline position. All right, cool. Shout out to all 130 something of y'all. If you guys are just joining, we're doing NCLEX questions. I'm going to put y'all on a stopwatch too, because I don't need nobody yelling at me, telling me to hurry up. All right, I'm gonna give y'all 20 seconds. Hey, if you guys are new, I want to know who you are, where you're from, and where you're at in your nursing journey. And if you're not a nurse, what is your field of occupation? What brings you here? Megan says D. Kayla says A. Also, make sure you guys like, share, and follow. Don't be greedy your whole life. Smash that like button. Smash it. Last time I think I had a 20-something thousand likes, like 25 or something like that. So I kind of want to stay around that. First semester Tallahassee. Every time I hear Tallahassee, it reminds me of T-Pain. Tallahassee love. Halfway done with nursing school. Shout out to you. All right, y'all. Here we go. Here's our answer. Here is our answer in 3, 2, and the answer is C, placing the tip of the dropper on the edge of the ear canal. The dropper should not touch any object or any part of the client's ear. Don't allow the dropper tip to touch the ear, finger, or any other surface. It could pick up bacteria or other germs that can lead to an ear infection. Hey, that is part of pharmacological and parenteral therapies. That is the second largest section on NCLEX. All right, so remember, when you guys are studying for your NCLEX, or any test rather, you always want to read your rationales to find out why the question is right. But you also want to know why these are incorrect, because you never know what kind of question is going to be further down the line. Okay. All right, so shout out to everybody that got that question. On to the next one. All right, we have question number 2. Nurse B should instruct the male client with an ileostomy to report immediately which of the following symptoms. Is it A, absence of drainage from the ileostomy for 6 or more hours, passage of liquid stool in the stoma, was it an occasional presence of undigested food, or a temperature of 37.6 degrees Celsius? What are we thinking? You learned this in health assessments. Shout out to you, AJ, for learning in health assessments. Hey, so I just want to let you guys know that these questions may there are a lot of multiple choice and select all that apply questions. And on the new generation NCLEX, the biggest thing that is different is that they've added the way that the questions are delivered to you. So you'll get, bow tie, the case studies, the close or drop down questions, which are like the fill in the blank type questions. You still get your dosage calculations, all those good things. It says C, and irritate the doctor every time it happens. I'll irritate a doctor just because. It ain't even got to be nothing about no ileostomy. You see, because it's not working. Okay. You're going to guess A. Yeah, who's that? I said it first. Yeah, right. You're going to guess A. I'd rather you guess than not pick anything at all. So, all right, here we go. Here's our answer. From Pennsylvania, just here to learn. Well, Niece, I'm glad that you're here to learn it, because we all learn it. All right, here we go. Answer in 3, 2, and the answer is A, absence of drainage from the ileostomy for 6 hours or more. Sudden decrease in drainage or onset of severe abdominal pain should be reported immediately to the physician, because this could mean that obstructions have developed. Sometimes the ileostomy does not function for short periods of time after surgery. This is not usually a problem, but if the stoma is not active for more than 6 hours, the patient experiences cramps or nausea, there may be an obstruction, right? It's backup of stool, right? Because it's not doing what it's supposed to do, right? You got to think it's just like, hey, essentially the stoma has become the rectum. So if there's nothing coming out of it, at some point you got to think of obstruction. Kind of think of when you are constipated and it's not going, like all the way to the colon, to the rectum, and all the way out the anus and out the body, right? So if it starts to become constipated at that end, it is voice for concern. What's up, King? What's up? How are you, sir? Here we go. Hey, a reduction of risk potential, okay? 9 to 12% on the NCLEX. Make sure you guys read your rationales. Even if you got the question right, make sure you read them. All right, here we go. Question number 3. Jerry has been diagnosed with appendicitis. He develops a fever, hypotension, and tachycardia. The nurse suspects which of the following complications. Is it an intestinal obstruction, peritonitis, bowel ischemia, or fluid volume, or deficit of fluid volume? That's right, because C can happen without, right? You got to think some of these questions, they'll give you everything that could happen, with a patient, but it's like, what's the thing that is the most concerning or the more right? Okay. All right, y'all. I'll give y'all 20 seconds. Hey, if you guys are new here, welcome. We're doing NCLEX questions. Got these from nurselabs.com. I want to know who you are, where you're from, where you're at in your nursing journey. Make sure you guys smash that like button. Make sure you guys share. Make sure you guys follow. Don't be greedy your whole life. I got 300 likes. Come on. Come on. Come on. Make it happen. Make it happen. Jackie says, I'm going to guess B. Okay, Jackie. That's cool. All right. Who is that? User A5. Thank you for appreciate the follow. Jackie, thank you for the rose. Girl, I appreciate you. Roses smell good. Roses are red. Bedside nursing is sad. I'm tired of this, Grandpa. That's too damn bad. All right, here we go. Oh, my God. Here we go, y'all. Here's our answer. Here is our answer. It says CVICU from Memphis, just here for fun. Oh, so you think just because you're CVICU, you're better than us, cat? Huh? Huh? No, I'm just playing. I'm just playing. Here we go, y'all. Here we go. There's our answer in 3, 2, and the answer is B, peritonitis, complication of acute appendicitis are peritonitis, perforation and abscess development. Diffuse peritonitis and sepsis can also develop, which may progress to significant morbidity and possible death. Post-operative abscesses, hematomas, and wound complications are all complications that can be seen after appendicitis. If the wound does not get infected, one can grow bacteriocytes. Recurrent appendicitis can occur if too much of the the appendiceal stump is left after the appendectomy. All right. So shout out to y'all. Appreciate everybody. I got this lecture. I got lectured on this after pathophysiology. I'm just letting y'all know pathophysiology was like my favorite class that I took. So, and that was from physiological adaptation, which is the third largest section on NCLEX at anywhere from 14 to 17%. Okay. So shout out to, it says a 4-year-old ASN. Current OR convinced I couldn't pass the NCLEX if I tried today. What does that even mean, Haven? You could do that. Girl, stop playing. All right, here we go. Question number 4. Which of the following complications should the nurse carefully monitor a client with acute pancreatitis? Is it an MI, cirrhosis, peptic ulcers, or pneumonia? What are we thinking? An ICU, Saudi Arabia, originally from South Africa. Shout out to you. You're in Saudi Arabia right now, King? I actually have a friend who did international travel nursing. He was from Egypt and he traveled to Saudi Arabia and he did that. So, okay. All right. Shout out to you, King. AJ is screaming B at me. All right, AJ, you ain't got to scream, girl. I see you. Shout out to all 300 of y'all in here rocking with me. If you guys are new, we're doing NCLEX questions. I got these questions off nurselabs.com. Make sure you guys smash that like button. Make sure you share, which is also important, but then also you follow. All right. So we got a good amount of questions today. All right. And then we're going to do an Ask Me Anything after this. So you guys can ask me anything in regards to nursing. You get personal. Yeah, I don't know what we'll do after that. So, but all right, here we go. Here we go, y'all. Here's our answer. Here is our answer in 3, 2, and the answer is pneumonia. The answer is D, pneumonia. All right. So here we go. A client with acute pancreatitis is prone to complications associated with the respiratory system. The relationship between the Mycoplasma pneumoniae infection and acute pancreatitis has been debated in the literature in 1973. Reported 4 adult cases of acute pancreatitis following pneumonia due to MP. In 3 of the patients, the pancreatitis occurred in the 3rd week after the onset of cough, by which time the respiratory tract symptoms had almost disappeared. Physiological adaptations. I just want to let you know. I'm just letting y'all know. I could give you 100 questions and there could be 10 of them that are wrong, but just because that they're wrong, it doesn't give you the excuse on why you shouldn't pass the exam. And remember, you're not going to get all these questions right. You're not going to get them all right. They're going to be funky. You may not like them. That's okay. We're not in the business if you like something. All right. So it's all about knowing what is and what is not. And if you don't know this one, then that's okay. You just move on to the next. Okay. I don't know how I passed the NCLEX. Trust and believe me when I tell you. You know how you pass it. It's called studying and repetition. That's how you do it. Kevin, did you see this Q bank from your? No, this is a Q bank from nurselabs.com. All right, it says RN from South Carolina already passed, but love testing my knowledge. Shout out to Miranda for being here. All right, here we go. Question number 5. Which of the following symptoms during the enteric phase of viral hepatitis should the nurse expect the client to inhibit? Is it watery stool, yellow sclera, tarry stool, or shortness of breath? What are we thinking? What are we thinking? I'm a really big content guy, and I'm a really big person on reading rationales. There's no tricks, y'all. There's no tricks on how to, how to differentiate questions. It's all about basing things off of what you know, applying what you know versus what you don't know. Okay. Bree, I appreciate the follow. Everybody screaming B at me. I got some C's over here. Okay. All right. If you guys are new here, inhibit. Exhibit, like X to the Z exhibit. What is he doing with himself? I want to go to nursing school, but I'm a slow learner. I'm really scared of a lot. Hey, if you're scared, go to church. If you're scared, go to church. I'm just letting you know that right now. There's no need for you to be scared at all. It's all about practice, practice, practice. All right, here we go, y'all. Here we go. Here's our answer. Here is our answer in 3, 2. And the answer is B, yellow sclera. Part of physiological adaptation. Remember, third largest section on NCLEX. Liver inflammation and obstruction block the normal flow of excess bilirubin turns the skin and sclera yellow and the urine dark and frothy. After 3 to 10 days, the urine darkens, followed by jaundice. Systemic symptoms often regress and patients feel better despite worsening jaundice. The liver is usually enlarged and tender, but the edge of the liver remains soft and smooth. All right. Yeah, there we go. So it's all about the jaundice, right? So one of those signs where we have somebody who has those type of issues, especially when it comes to the liver, right? One of those big signs, bilirubin in the skin, also bilirubin popping up in the sclera of the eyes. All right. So here we go. Appreciate everybody. I love everybody's participation. We're going to go on to the next one. Make sure you guys are reading your rationales. Okay. Read your rationales. All right. Hey, real quick commercial break. Make sure you guys participate. Give me all them likes, shares. Make sure you guys follow. Don't be selfish. You never know who else is going to need this. All right. Don't troll my chat. If you troll my chat, I'm going to ban you. I got these questions off nurselabs.com. 7-day NCLEX course, $48 for a lifetime. It's in its pre-launch phase. I'm getting some stuff up there here in the next week or so. If you need one-on-one coaching for NCLEX, check out the link in my bio. Also, we're going to do an AMA at the end of this, so make sure you guys stick around for that. All right, here we go. Question number 6. Marco, who was diagnosed with a brain tumor, was scheduled for a craniotomy. And preventing development of cerebral edema after surgery, which of the following, the nurse should expect the use of what? Diuretics, anti-hypertensives, steroids, or anticonvulsives. We got some C's, we got some A's. Okay. If you guys are just joining, we're doing NCLEX questions. Got these questions off nurselabs.com. Make sure you guys like, share, and follow. Don't be selfish your whole life. And also, I want to know who you are and where you're from and where you are at in your nursing journey. And if you're not a nurse, what do you do? And why are you here? Robert says Texas. Shout out to Texas. Hey, it's cold out here now. Hey, it's 48 degrees in San Antonio, and I don't know why. All right, y'all, 20 seconds. Gumdrop says diuretics. You're in Iowa? Girl, I know it's cold up there. Took my NCLEX on Thursday. Whoa, hold on. Somebody just said I took my NCLEX on Thursday. Your girl's officially a PN. Shout out to the Air Force for letting me challenge the board. Shout out to you. Is it Gabrielle? Hey, Gabrielle, y'all, she's a nurse now. Make sure y'all give her some love. Give her some love. I'm proud of you. I'm glad that you're now a nurse out here rocking it. Shout out to the Air Force for letting you challenge it. Hey, you can only challenge the LPN or the LVN exam in certain states, depending on, what your occupation is. So everybody show her some love right now. Welcome to the shit show, ma'am. Welcome to the shit show. Here we go, y'all. Here we go. Here's our answer in 3, 2. And the answer is C, steroids. Glucocorticoids or steroids are used for their inflammatory or their anti-inflammatory action, which decreases the development of edema. Corticosteroids produce their effect through multiple pathways. In general, they produce anti-inflammatory and immunosuppressive effects, protein and carbohydrate metabolic effects, water and electrolyte effects, central nervous system effects, and blood cell effects, right? Hey, physiological adaptation, third largest section on the NCLEX. Appreciate everybody for the follows. There's so many of y'all. I don't even know what to do right now. So I appreciate all y'all. We're going to go on to the next one. Technically, the answer should be diuretics, right? But you're right. Technically, the answer should be, but that answer is not on there, right? So you go based off of the answer that is being presented to you. If you start thinking like, no, it was mannitol, or no, it was this, no, it was that. I mean, hey, give or take. Right? If you do that and you start doing a bunch of what ifs, you could possibly get the question wrong. So you got to remember that people are in different stages in their nursing journey. So they don't know you don't know what you don't know until you don't. You know? So there's that. Question number 7. Halfway through the administration of blood, the female client complains of lumbar pain. After stopping the infusion, Nurse Hazel, how old is Nurse Hazel? It doesn't matter. Nurse Hazel should what? Increase the flow of normal saline, assess the pain further, notify the blood bank, or obtain vital signs. All right, hold on, y'all. I got to ban somebody because somebody's trying to send nudes to me again in the chat. Like, why would you want to send nudes in the chat? Come on, guy. All right, everybody's B, C, what? LOL. I'm trying to, look, Trace, I'm trying to tell you. People come in here saying, hey, come to my link, buy my nudes. First of all, why would I buy nudes when I can get them for free? All right, 10 seconds, y'all. I'm awake now. Make sure y'all like, share, follow. Hey, Raquel, people really are weird. I just passed mine. I can give you one question I remember. Robert, you just passed what? All right, here we go, y'all. Here's our answer. Maybe it's a personal, maybe. NCLEX RN. When did you pass, Robert? So we can give you your flowers. Hey, the answer is A. You want to increase the flow of normal saline. All right. So and as part of pharmacological and parenteral therapy 2 days ago, shout out to everybody. Give Robert his flowers. Show Robert some love. Welcome to the shit show. Being an RN, Robert. So congratulations to you. All right. So here we go. I'm going to read this rationale. The blood. Sorry if you guys can't see that, but the blood must be stopped at once. Then normal saline should be infused to keep the line patent, and maintain blood volume. It says treatment is to stop the infusion, leave the IV in place, IV fluids with normal saline, keeping your urine output greater than 100 an hour. Diuretics should also be needed, and cardiorespiratory support as appropriate. A hemolytic workup should also be performed, which includes sending the donor blood and tube, as well as a post-transfusion lab from the recipient to the blood bank. All right. There we go. It says not right for the NICU. You're right. Hey, NICU, y'all got your own thing going on up in there. Just like, hey, policies will change depending on what, where you go, like where your hospital's at. Also, what floor you work on. So would you think the assessment would be more important based off of if you have something? So I guess the rule of thumb is like you want to assess before you do, unless delaying assessing causes more harm to your patient. So if I have a sign or a symptom no, sign or a symptom, doesn't matter, that is presented to me based off of a blood transfusion, then I'm definitely going to be like, I'm going to assess my patient. Remember, like I said, a lot of these aren't going to be right based off of what you think, right? And like I said, it's no excuse for you to, like, if I have 100 questions if I have 100 questions and 10 of them are wrong, there's no excuse that you would still fail the exam, right? Okay, so just think about that. So always remember, you can remember ADPI, never forget the nursing diagnosis. I promise you, when you take the NCLEX, it's always going to be there. All right. Good questions, though. Question number 8. Nurse Maureen knows that the positive diagnosis of HIV infection is made based on which of the following? Is it a history of high-risk sexual behavior, the positive ELSA and Western blot test, identification of an associated optimistic infection, or evidence of an extreme weight loss and high fever? Everybody's screaming B. Bravo. Okay, I see you. No Alpha, no Charlie, no Delta. Kelsey says B. Okay, I'm going to give y'all 15 seconds. All right. Hey, if you guys are new here, welcome. We're doing NCLEX questions. I got these questions off nurselabs.com. Okay, free batch of questions. Bumblebee. Free batch of questions. Make sure you guys go over there and check that out. Make sure you guys smash the like button. Make sure you guys share, and make sure you guys follow. That's what the TikTok algorithm wants in order to push it in front of people. And that's what I want, because I want it in front of people. So let's make that happen. I want to know who you are, where you're from. It's pronounced Eliza. What did I say? Did I say Elsa? I did say Elsa, huh? I'm over here watching way too much Frozen. My bad. All right, y'all. Here we go. Hold on. It says, here's what I think, but damn, the NCLEX is going to say C. It just might. All right, here we go, y'all. Here's our answer in 3, 2. I really did say Elsa. Eliza. All right. So the answer is B, positive ELISA and Western blot tests. These tests confirm the presence of HIV antibodies that occur in response to the presence of the human immunodeficiency virus. When there is a possibility of acute or early HIV infection, the most sensitive screening the immunoassay available in addition to HIV virolytic test is performed. The RT-PCR based viral load test is favored. A positive HIV virolytic test generally indicates HIV infection. That's part of the physiological. Nailed it. Shout out to you, David. But part of physiological adaptation. All right. Third largest section on NCLEX. Hey, it's super important that you read your rationale. Rationale is where you are able to retain the information. Like everything has an intricate part. Think about your car. Well, I can't say think about your car unless it's a Tesla, but think about your car. Those small little microchips can shut your whole car down, right? So everything has a working part. So reading your content, understanding it, doing your questions, understanding it, and you're reading and reviewing your rationales, understanding it, whether you got it right or wrong, okay? So seems like it's teaching, not relying on an institution, right? It's not. All right, here we go. Question number 9. Nurse Maureen is aware that a client who has been diagnosed with chronic renal failure recognizes an adequate amount of, high biological value protein when the food the client selected from the menu was what? Raw carrots, apple juice, whole wheat bread, or cottage cheese. To be honest, I don't know how anybody can eat cottage cheese. It's kind of gross, but shout out to appreciate everybody for the follow. Hey, if you guys are new here, I want to know who you are, where you're from, where you're at in your nursing journey. Hey, and if you're not a nurse, let me know. Let us know, not just me, but let us know what your occupation is and what brings you here. We're doing NCLEX questions. You love cottage cheese? Alyssa, nobody asked you if you like cottage cheese, ma'am, okay? I'm just not a big fan of cottage cheese. So it's so good. No, you did not say it's so good with eggs and mustard. Gross, Kelsey, gross. Not a nurse, healthcare PR, okay? Graduating in May and can't wait. I bet you can't. Haters gonna hate, ma'am. I'm not hating. What you mean? DC here. Enjoy going over info and remember education. Shout out to you, nursing student. All right, cool. All right, y'all. No, not cottage cheese. Not a nurse yet, but a surgical tech. I'm also a surgical tech. I'm a surgical tech in the Navy, for those that don't know. I'm also an instructor in the Navy. I'm a master instructor in the Navy as well. So, hey, shout out to everybody. I know what it's like to have different occupations and coming in to do stuff. Knickknacks, I've been a nurse for 17 years. Shout out to you. What's your specialty, knickknack? Patty whack, give a dog bone. All right, here we go. Here's our answer in 3, 2. And the answer is D. It is cottage cheese. 1 cup of cottage cheese contains approximately 225 calories, 27 grams of protein, 9 grams of fat, and 30 milligrams of cholesterol with 6 grams of carbohydrates. Proteins of high biological value contain optimal levels of amino acids essential for life. In general, proteins from animal sources have a high biological value than proteins from plant sources. Animal sources of protein are meat, poultry, fish, eggs, milk, cheese, and yogurt, and they provide high biological value protein. Oh, who said that? I think it wasn't Alyssa. Somebody said something about cheese and eggs, and I was just like, wait, you put eggs and cheese inside of your cottage cheese? That's disgusting. How dare you? Yeah, I got it right. You do not look old enough to have been a nurse for that long. Are you talking about me, Jackie? Jackie, I've only been a nurse for 3.5 years, not 17. If you're talking about Miss Thang over there for 17 years, right? That's what I would say. That's the same thing I would say. I am from SA, like San Antonio. We'll be doing the NCLEX soon. Shout out to you, Miss Pink. All right, here we go. Here is question number 10. Kenneth, who was diagnosed with a uremic syndrome, has the potential to develop complications. Which among the following complications should the nurse anticipate? Is it the flapping hand syndrome, an elevated hematocrit level, hypotension, or hypokalemia? Oh, I was confused, but she doesn't look old. Oh, no, Jackie, come on now. And first of all, I think that's a compliment if you say, you don't look like you've been in or been doing that long. And you don't look the age, I guess you fit. I mean, I've been in the Navy for 16 years, but people don't, when I tell them that, they're like, where? Like, how? I'm going to be like, I don't know. I was just like, a lot of the stress that the military causes me to look young, but make me feel like I'm double my age. You can't see the question? Trace, how come you can't see the question? Boy, bye. You are not that old. Ma'am, stop. Don't do that. I am old. I turned 36 on Saturday, so I'm old as shit. All right, y'all, here we go. Here we go. Hold on. Let me see. Let me bring this down because somebody said they can't see it. Your crown's on its way. Shout out. Yes. Marissa742. Shout out to you. Shout out to you, ma'am. All right, wow, that's young. Hey, look, I'm telling you, I'm young, but I don't feel young. My body does not feel that way. I'm just telling you. All right, here we go. Here's our answer, y'all. Here is our answer in 3, 2. And the answer is A, flapping hand tremors. Let's see. Elevation of uremic waste products causes irritation of the nerves, resulting in flapping hand tremors. The classic description has been in hepatic diseases, but other causes can commonly cause was it estrixis? I'm going to say estrixis, including azultemia and respiratory diseases. Estrixis is a disorder of motor control characterized by an inability to actively maintain a position and consequent irregular myoclonic lapses of posture affecting various parts of the body independently. I just want to let y'all know the language of which they say this, nobody fucking talks like that. Nobody talks like that at all. Y'all can correct me all you want. Do I look like a 10-year-old getting ready for a spelling bee? I am not. So if I pronounce it wrong, I'll try to pronounce it right, but there's no promises. No promises there. I'm just letting y'all know. All right, here we go. On to the next one. Hey, physiological adaptation, y'all. Third largest section on NCLEX. All right, here we go. Hey, real quick. We're doing NCLEX questions, commercial break. Make sure you guys participate. I love all the participation that you guys are giving. So like I said, make sure you guys participate. I'm kind of funny sometimes. It all just depends. Make sure you guys share, follow. Give me all them likes. Don't be selfish your whole life. Do not be selfish your whole life. You never know who's going to need this. And I need this, okay? I need for y'all to be my friend, all right? Don't troll my chat. You troll my chat, I'm going to ban you. I got these questions off nurselabs.com. All right, that is where I got them from. This is a randomized one. I think it's a comprehensive exam. So you guys can go over there and check those out for yourself if you want. 7-day NCLEX course is my course I created. It's in a pre-launch for $48. You get this, you get it for a lifetime. So if you're an LPN, it works for both, okay? If you want or need one-on-one coaching for the NCLEX, you guys can go over there and check that out. Both those links are in my bio, and we're going to do an AMA after this, okay? So there we go. Let me know if you guys can't see that. Appreciate all the likes and the follows. So here we go. Let's go. Question number 11. A client is admitted to the hospital with benign prostatic hyperplasia. The nurse most relevant assessment would be what? Flank pain radiating to the groin, distension of the lower abdomen, perineal edema, or urethral discharge. What are we thinking? What are we thinking? Hey, if you guys randomly start hearing me start singing Wind Power, it's because my son watches Blaze and it's stuck in my head. So don't judge me. Hey, if you guys are new here, we are doing NCLEX questions. I got them from nurselabs.com. Make sure you guys smash that like button. Make sure you guys share. Make sure you guys follow. All right. And I want to know if you're new here, I want to know who you are, where you're from, and where you're at in your nursing journey. And if you're not a nurse or on a nursing journey, what type of journey are you on? What's your occupation? What you doing? What you doing with your life? All right, y'all, 10 seconds. Say B, okay. I'm a medical malpractice lawyer. Shout out to you, Allie. Rose, nursing student, okay, all right. Medic, 8 years. I saw medic 8 years. Registered nurse from the Caribbean, getting ready to do that NCLEX. I know that. Is it Levy or Levy? Shout out to Kristen Villas. Okay, 30 years, okay. Defense or prosecute? He's like, I'm asking. I'm a pharmacy tech. Shout out to you. New nursing grad. Shout out to you. All right, here we go. Corman we're trying to go PA. Hey, how about we say Corman going to be a PA? Come on, guy. One of my buddies, he's actually a corpsman. Well, he's not a corpsman anymore. He's a PA in the Navy now. So shout out to him. I have another one of my buddies who got out as a corpsman and who is now working as a PA at the VA actually. So it could be done. It could be done. There are multiple routes for you to do it. Hey, if you got any questions about being a PA, man, just shoot me a DM and I could possibly link you up with them so, you can kind of see the route that they took. So, all right, what it says, almost an anesthesiologist. Ashley, shout out to you. About to be an anesthesiologist. All right, here we go. And the answer is B, distension of the lower abdomen. This indicates that the bladder is distended with urine, therefore palpable. In the elective setting, the examination should include abdominal examination, and examination of external genitalia. Benign prostatic hyperplasia refers to the non-malignant growth or hyperplasia of prostate tissue and is a common cause of lower urinary tract symptoms in men. PBR. I called her Amanda. Her name is definitely Ashley. My bad. I'm sorry. I feel bad about that. So it says, since when nurse examine patients? Depends. Honestly, nurses can examine patients. Nurses do nursing assessments. All right. So when you do a nursing assessment, you got to let the doctor know, what your findings are. Let them know, hey, what's going on, this, that, and the third. Or if you have reoccurring assessments, as you do when you're doing change of shift or anything like that. So, all right, here we go, y'all. Here we go. Hey, physiological adaptation, third largest section on the NCLEX. All right, here we go. Here we go. Question number 12. A client has undergone a penile implant after 24 hours of surgery. The client's scrotum is edematous and painful. The nurse should what? Assist the client with a sitz bath, apply warm soaks in the scrotum, elevate the scrotum using a soft support, or prepare for a possible infection and drainage. What are we thinking? All right. I had one of these frightening. What? What? What'd you do then? Who is that? Trace? No comment. I couldn't find. Oh, okay. I got you, Trace. I got you. Kristen, again, I would say C after 30 years. Okay. Post-op. Okay. I'm tracking. Hey, if you guys are new here, welcome. We're doing NCLEX questions. Going to do about another 20 seconds on this question. We're doing NCLEX questions. I got them off nurselabs.com. Okay. Make sure you guys like, share, and follow. Like, share, and follow. And also, I want to know who you are, where you're from, where you're at in your nursing journey. All right. Make sure you guys participate. That's the best thing about doing these TikTok lives about questions is like you guys participating and get to know y'all a little bit. I see some regulars that pop up in here and I see nothing but new faces all the time. So I appreciate everybody liking, sharing, and following. Somebody said, I'm taking my NCLEX. I can't decide if it's A or C. Pick one. Pick an answer and run with it. And if you get it wrong, cool. Now you're going to know why that answer is the correct answer. All right. So that's the whole thing about when you study. Retired OR nurse, I say C. I actually work in the OR as well. So I worked in the ICU, I worked in PACU, and I worked in the operating room. And the operating room is my home, is my current home. So, all right, here we go. Here we go, y'all. Texas, and I work at the VA. So thank you to all those vets. Shout out to all my vets out there. Here we go. Here's our answer in 3, 2. And the answer is C, elevate the scrotum using a soft support. Elevation increases lymphatic drainage, reducing swelling and pain. The penis should then be placed upward on the lower abdomen to limit any downward curvature of this penis post-operatively. Scrotum support or tight mesh underwear might be used after the sterile dressing is removed. This is a reduction of risk potential. And it's crazy when you start to read your rationales, you'll start to know the sections of the NCLEX, the client needs. You'll start to know like where they fall under. Like if you get a medication question, 9 times out of 10, it's going to be from pharmacological and parent-child therapies. Okay. So just think about that. All right. So here we go. Here we go. Appreciate everybody's participation. I love it out here. Thank you for the rose. Thank you for the rose. I appreciate you. Here we go. Nurse Hazel received emergency laboratory results from a client with chest pain and immediately informs the physician. An increased myoglobin level suggests which of the following? Is it liver disease, myocardial damage, hypertension, or cancer? Cancer. Trace says, wait, what'd you say, Trace? I'm going to write a book, Tales from the Crypt. Hey, do it. Hey, you should write it. You should write it and let me know. And I'll totally support that. Hey, he said, who uses myoglobin anymore? Look, okay. Not my questions, okay? Not mine, all right? Everybody's screaming B at me. He says, I got some crazy stuff. Look, hey, for all my nurses that are out there, and I'm specifically talking about nurses because I'm a nurse. I already know y'all got some crazy stories. Every so often y'all can, you post a crazy story down there and let's see. It probably won't fit all the way down there, but I'm just saying, hey, if you can summarize a crazy story, I got some crazy ones? Let me tell you. All right, here we go, y'all. Here's our answer. Here is our answer in 3, 2, and the answer is B, myocardial damage. Detection of myoglobin is a diagnostic tool to determine whether myocardial damage has occurred. Myoglobin, an oxygen-carrying protein found in cardiac muscles and striate skeletal muscles, presents an active alternative to the C, P, K, and L, DH in the emergency department setting for identification of acute myocardial infarction. Myoglobin levels may be elevated in the serum within 1 hour after myocardial cell death, with peak levels reached into 4 to 6 hours. Sorry if I'm reading this all slow. I'm just like it's small for y'all and it's also small for me. I wish I could make this bigger, but I can't. So there's that. But yeah, there's our answer. Hey, physiological adaptation, third largest section on the NCLEX. That's how it is. That hey, it may not be right because it's not saying it's outdated, but they still ask a lot of those questions because depending on where you are in the nation, they may not have specific things. They may not do specific labs. It says stays in the blood longer than troponin. Really, the only use is detecting MI after troponin clears. Okay, yeah, I would agree. I would agree. Just like I'll give you an example. Like if we start talking about like usually now for ventricular arrhythmias, the medication of choice per NCLEX is amiodarone, but you can also use lidocaine for ventricular dysrhythmias. But if you only have lidocaine, that's the answer to choose. But if you have amiodarone, you're going to choose amiodarone over lidocaine. Like we're not getting into the intricacies of what the heart disease is that's happening. We're not getting into it. Those are the two big medications to think about. Okay. All right, here we go. Question 14. Nurse Maureen. Wow, Nurse Maureen and Nurse Hazel just be at it. I'm just trying to tell you. We must be on a cardiac unit. Would expected client with mitral stenosis would demonstrate symptoms associated with congestion in the what? Right atrium, superior vena cava, aorta, or pulmonary. Is it Mademoiselle? Mademoiselle, it's $48. That's how much the course is. And I'm just letting y'all know after Cyber Monday, like the day after Cyber Monday, it's going up to $97. I'm letting y'all know that right now. And I'm going to be saying that all the way up until Black Friday or all the way up until those time comes. So D for don't know. That's fair. That's fair. Oh, you're like D for pulmonary and I don't know. D Martinez, you can go to my website and it'll tell you everything that's included in my course. All right, y'all, here we go. Here's our answer. Here is our answer in 3, 2, and the answer is D. See, look, D for don't know is D. I got the right answer. D for is pulmonary. All right, when mitral stenosis is present, the left atrium has difficulty emptying its content into the left ventricle because there is no valve to prevent backflow into the pulmonary vein. The pulmonary circulation is under pressure. Mitral valve areas less than 2 square centimeters causes a backflow of blood into the left atrium, into the right or into the left ventricle. This creates a pressure gradient cross the mitral valve. As the gradient cross, the mitral valve increases. The left ventricle requires the atrial kick to fill with blood. All right. Physiological adaptation. Once again, third largest section on the NCLEX. All right. Makes up anywhere like 14 to 17%. So make sure you guys are very aware of that. Hey, so just before you guys think, I want you guys to really think about something. Management of care, physiological adaptation, and pharmacology make up 44 to 49% of the entire NCLEX exam. To include, that's for RN and for LPN. Okay. Anyone else getting a little nervous? Michelle, what you getting nervous for? What you getting nervous for? There's no need to be nervous. Even though I would tell you not to be nervous, if you prepare and you recreate the testing center and you practice like what the test is supposed to be like, what it looks like, what the environment looks like, you go in there less nervous. I can't say you go in there zero nervousness, but you go in there with less nervousness. Okay. All right, here we go. Question 15. A client has been diagnosed with hypertension. The nurse's priority nursing diagnosis would be ineffective health maintenance, impaired skin integrity, deficit in fluid volume, or pain. Look, I know what somebody's about to say. Oh my God, these are easy. Like I said, not my questions, number one. Number two, you don't know where anybody is at in their nursing journey, and this may be very new to them. So we still got people learning on all different levels. All right. Hey, if you guys are new here, welcome. We are doing NCLEX questions. Got them off nurselabs.com. Make sure you guys like me, share for me, and follow me because, I'm kind of cool sometimes. It just depends on whatever. Who said hi to me? What's up, Bree? How are you, ma'am? And yeah, so I want to know who you are, where you're from, where you're at in your nursing journey. If you're not a nurse, I want to know what you do. Hey, as a matter of fact, one quick little shout out while you guys answer this. But if you are a patient care tech, an LVN, an LPN, occupational therapist, respiratory tech therapist, X-ray, all those ancillary services. Let me tell you, I love y'all and I appreciate y'all. And I love and I appreciate y'all. I ain't gonna let nobody ever disrespect y'all around me. I'm telling you, I've seen some people just get out of pocket. I'm like, hey, bro, chill the fuck out. Chill out. All right. So, hey, for all my folks that are out there, All my folks that are out there, even my medical assistants, I love y'all. I love every single one of y'all. Like y'all make the world go round when we need shit happening. But hey, physical therapy, hey, I'm just letting y'all know. Y'all go back, y'all keep going into my rooms and y'all don't be putting shit back. I'm gonna come for you. I love y'all though. But shout out, I love y'all. Can you tell us the answer? I was getting there. I'm sorry. I didn't realize I was taking up all your time. My bad. I'm just like, oh, Christy, okay, I'm getting there. Can I get there? Okay. All right, here we go. The question or the answer is A, ineffective health maintenance. Managing hypertension is the priority for the client with hypertension. Who would have thought? Clients with hypertension frequently do not experience pain, deficit volume, or impaired skin integrity. It is a asymptomatic nature of hypertension to make it so difficult to treat. Monitor and report blood pressure. Monitor both arms and thighs 3 times. 3 to 5 minutes apart while the patient is at rest, then sitting, then standing for initial evaluation. Use correct blood cuff size and accurate technique. This is reduction of risk potential. All right. So since everybody's rushing me, I guess I just got to go through all the questions in like 5 seconds so nobody can read them because apparently people are impatient. Okay. All right. Hey, real quick, commercial break. Don't y'all go nowhere. Don't you leave. Stay right there. All right, hey, we're doing NCLEX questions. Make sure you guys participate. Make sure you guys share. Make sure you guys follow. Make sure you guys give me all those likes. This is what gets it out to people who need it, okay? Don't be selfish your whole life. Don't troll my chat. If you troll my chat, I'm going to troll you back, and then I'm going to ban you, okay? So don't be rude, all right? Don't be trying to sell me your nudes either. Who buys nudes anymore? You can get them for free. Anyways, I got these questions off nurselabs.com. 7-day NCLEX course. You get it for a lifetime. It's in its pre-launch phase, $48. Check the link out in my bio. Also, if you need one-on-one coaching or tutoring for the NCLEX, that link is also in my bio. And we're going to do an Ask Me Anything following the NCLEX question. So if you're interested in that, you guys can hang out and see my hideous face. Okay, here we go. Question 16. Once again, Nurse Hazel doing something. Nurse Hazel teaches the client with angina about common expected side effects of nitroglycerin, including high blood pressure, stomach cramps, headache, or shortness of breath. What are we thinking? Oh, Sandy, I didn't see you. I didn't see you jump up in here. Shout out there. Who is that? Is it Jamessa? Is it Jamessa? Thank you for the follow. Somebody said something about angina. Angina is a pain, chest pain. All right. There you go. There you go. All right, y'all. 15 seconds. Hey, if you're new here, we're doing NCLEX questions. Make sure you guys like, share, and follow. Smash that like button, like until you get carpal tunnel. Yeah, I said it. And then if the doctor asks you, just be like, look, I was giving Kevin some love out there. All right. Hey, and if you're new here, I want to know who you are, where you're from, and where you're at in your nursing journey. Is it Yari? Yari, thank you for the roses. I appreciate you. All right, here we go, y'all. Here we go. Here is our answer. PCT. You gave me a dinosaur? Girl, stop it. That's so cute. Look at that thing. I ain't never got no dinosaur before. But all right, here we go. Here's our answer in 3, 2. And the answer is C, a headache. Because of its widespread vasodilation effect, nitroglycerin often produces side effects such as headaches, hypotension, and dizziness. Headaches can be severe, throbbing, and persistent, and may occur immediately after use. I'm telling you something right now. When you use these cardiac meds, they're extremely fast, like damn near almost instant, right? Vasodilation and venous pooling can increase the amount of blood into the cranial space, resulting in an increased intracranial pressure. This can cause persistent throbbing headaches along with confusion, fever, vertigo, nausea, vomiting, and visual disturbances. Okay. Pharmacological and parenteral therapies. Remember, second largest section on NCLEX at 18%. Okay. Wear gloves. Always. I don't even know what we're talking about right now. So NYC started my RN program in 2025. Okay, Caramel. All right, Carol. Okay, girl. All right, here we go. Question 17. The following are lipid abnormalities. Abnormalities. You heard what I said. Which of the following is a risk factor for the development of atherosclerosis and PVD? Is it high levels of low-density lipid cholesterol, high levels of high-density lipid cholesterol? Is it low-concentration triglycerides? Or is it low levels of LDL cholesterol? What are we thinking? Hey, if you guys are new here, welcome. We're doing NCLEX questions. Marcella, sorry. Hey, I'm in Michigan, and I just got done with my pharmacy class, but I have to take my pharm test. Okay, so this would be right up your alley then. All right, Candace says A. All right, we got some A. Everybody's screaming A at me. Is it Maya? Maya? I'm saying Maya. Thank you for the follow. Appreciate you. All All right, I'm gonna give y'all 10 more seconds. Hey, if you're new here, make sure you guys smash that like button. You guys share and you guys follow. All right. A for Apple. That the patient. Okay, Marissa, I got you. I took my NCLEX a year ago, and this is still triggering me. Look, let me tell you something right now. Everybody got a little, post-traumatic, stress in regards to studying and taking this exam. Okay. All right, here we go, y'all. Here's our answer. Here is our answer in 3, 2, and the answer is A. You want high levels of low density lipid cholesterol. An increase of LDL cholesterol concentration has been documented as a risk factor for the development of atherosclerosis. LDL cholesterol is not broken down into the liver, but is deposited into the walls of the blood vessels as the LDL particles leave the blood and enter the arterial intima. Like, I swear to you, I don't know who the fuck says that, but no one says intima. Like, it sounds like enema, but whatever. They accumulate by being trapped by the protoglycans and are modified. While the modification of LDLs are not elucidated, oxidative modification generating oxidized LDL appears to be an attractive candidate. No one talks like that. I'm just letting you know right now. No one ever talks like that. It says, do midwives write the NCLEX? So in order for you to become a midwife, you have to take the NCLEX prior, and then you have to go and work in labor and delivery. And then you have to have a certain amount of hours in order to go, and you have to get your master's degree in that level as well. So I didn't like UWorld too specific. Archer got some vague questions like the NCLEX did my first attempt. So I didn't like UWorld at all, me personally, because I'm a visual person, so it's not all the reading that'll just do it for me. I have to have an accumulation because I'm a different type of learner. All right. And also be aware of what type of learner that you are. Not everybody learns the same. I can put a book in front of, I'll use Sabrina. I could put a book in front of Sabrina and she'd read it all day. You put a book in front of me, I'm falling asleep. 10 minutes. All right. So are you a visual? Are you auditory? Are you kinesthetic? Are you a read write? Are you a combination of, all of them? So think about that. That is, and how do you best retain information? UWorld just upgraded. I saw that. I did see that. Which of the following represents a significant risk immediately after surgery for repair of an aortic aneurysm? Is it wound infection, ineffective coping, electrolyte imbalance, or alteration in renal perfusion? So if I remember right, for UWorld with their upgrade, they upgraded their prices, but I think they put videos in there. I don't know. I haven't used UWorld in years, so. But every single NCLEX review out there is upgrading to the new generation NCLEX type of questions. Good to know. I still got some knowledge. It's been 5 years since NCLEX. Okay, shout out to you. Hey, if you guys are new here, we're doing NCLEX questions, so make sure you guys like, share, and follow. I got these questions off nurselabs.com, so if you want to go check that out for yourself, you are more than welcome. Eliza passed my NCLEX on Wednesday of last week. Shout out to you, Eliza. Everybody give Eliza some love. Shout out to her. Welcome to the shit show. Right? I'm very, very proud of you. You're about to go out there and do really great things. What type of, which exam did you take? Did you take the RN or did you take the PN, Eliza? Let us know. Hey, if you come into my chat at any point in time and you tell me that I was able to help you in any way, please send me a DM. I want to definitely give you guys a shout out and post it all over my website for like the testimonials and all that other good stuff. Like, because you have no idea how helpful that is going to be for people. An RN, shout out to you. Shout out to you. Not good. User 57. I remember that face. I forgot what your name was, though. Here we go. Yes, I want to hear it. Okay, here we go. Here's our answer, y'all. Here's our answer in 3, 2. And the answer is D, potential alteration in renal perfusion. There is a potential alteration in renal perfusion manifested by decreased urine output. The altered renal perfusion may be related to renal arterial embolism, prolonged hypotension, or prolonged aortic cross-clamping during the surgery. Intervention or surgical treatment risks versus benefits of repair in patients at increased risk for open heart or for open surgery should be considered, and no intervention may be appropriate in some cases. Patients should be well informed regarding their options, risks of repair, and potential post-operative complications. All right. That is for reduction of risk potential. Smaller section on NCLEX from 9 to 12%. All right. So make sure you guys are reading your rationales. Whether you got the answer right or wrong, you need to be reading your rationales. Okay. I like Archer as well. Archer has really good questions. Use that for 2 months and you loved it. Shout out to you. I know. I actually talked to a couple of people over at Archer for some future things. So, all right. Here we go. On to the next one. But congratulations again, Eliza, for, doing your thing, and now going out there to do even better things. Okay. Here we go. Question 19. Nurse Josie should instruct the client to eat which of the following foods to obtain the best supply of vitamin B12? Is it dietary products? Oh, I'm sorry. Is it dairy products, dietary products? Is it dairy products, vegetables, grains, or broccoli? What are we thinking? Hey, if you guys are new here, we're doing NCLEX questions. Make sure you guys like, share, and follow. I'm pretty sure everybody can see that. If you can, I'm going to turn it just a smidge. All right. Make sure you guys like, share, and follow. I want to know who you are, where you're from, where you're at in your nursing journey. And if you're not a nurse, what do you do? What do you do? What do you do? Shout out to all of my ancillary services out there. I appreciate all y'all. Hey, you know what? They don't get enough love, but shout out to all the doctors that are out there. I know sometimes we give the doctors a lot of shit because, the stigma of, how doctors treat nurses and stuff like that. But there are a lot of great doctors that are out there, and I worked with a bunch of them. All right. Shout out to my nurse practitioners too. I've worked with some really great ones too. I have 2 of them that are wonderful, wonderful, wonderful people that taught me a lot when I worked in the ICU. So once you guys find some really good mentors and really good, people that help you accelerate through your nursing journey and career, hold on to those people. Okay. All right, y'all. Here we go. Here is our answer. Here, graduate. Is it Carolina? You graduated in December. Shout out to you. All right, y'all. Here we go. Hospitalists are great surgeons. You just have to stand up to them. You're right. I worked with plenty of surgeons as a surge tech and as a circulating and scrub nurse. Look. I don't know if it's me, but I don't let people talk to me like they lost their mind. So there's that. Currently a corrections officer, but also a med tech and CNA. Shout out to you, Urban. All right. What it says, if I can give one tip for NCLEX. Eliza, give us all the tips for NCLEX right now. Tell us. And the answer, of course, is A. Good source of vitamin B12 are dairy products and meats. Among animal products, those from, ruminants are particularly rich in vitamin B12, which is naturally synthesized by the ruminal microflora and transferred to milk. Dairy products retain in general a major part of vitamin B12 naturally present in milk. Some processing conditions may even add to the basal level to produce by production of vitamin B12. I'm sorry, y'all. My son started screaming in there because he's watching something and I started laughing. So it said, I'd rather just not gain that point. I have a point to take away. Partial credit is everything. Partial credit is everything. Basic care and comfort from that question, y'all. So partial credit, y'all. Partial credit on select all that apply, right? You get partial credit on select all that apply. When I took my exam, it was at 75 to 265 questions. And then it went to 60 to 145. And then now it's at, 85 to 150. There was no select all that apply when I took my exam. So that is when the new NCLEX, when the new generation NCLEX updated itself April 1st, that is a godsend. I'm trying to tell you, it's a godsend. Here we go. Karen, wow. Karen has been diagnosed with aplastic anemia. The nurse monitors for changes in which of the following physiologic function. Is it bowel function, peripheral sensation, bleeding tendencies, or intake and output? What are we thinking? All right. What else, Eliza? What else? What other T? What other T you got? Hey, here's a question for you, Eliza. Can you take the NCLEX without studying for it? I've literally had some people say there's no need to study for it because it's easy. So I would love your opinion as somebody who just took that. If you guys are new here, we're doing NCLEX questions. I got them off nurselabs.com. Make sure you guys like, share, and follow. Don't be greedy your whole life. All right. And I want to know who you are, where you're from, and where you're at in your nursing journey. What? You thought it was easy? Sandy, you thought it was easy and you failed? I'm not even gonna lie to you. The first time I took the NCLEX, I thought the same thing, and that's exactly why I failed the first time. And in case y'all don't know, I failed my NCLEX 3 times. 1, 2, and 3. I failed it 3 times. So, and I have no shame in telling nobody that, none whatsoever. So here we go. And we can talk about that later. So here we go. And the answer was C. It was bleeding tendencies. Aplastic anemia decreases the bone marrow production of RBCs, white blood cells, and platelets. The client is at risk for bruising. For bruising and bleeding tendencies. Aplastic anemia refers to the syndrome of chronic primary, what is that? Oh my God. Hematopoietic failure. There it is. From injury leading to diminished or absence hematopoietic precursors in the blood marrow and attendant pancythemia. There we go. That's where we're going. That's what we're going with. Look, I tell you, it'd be hard out here. It'd be hard out here trying to pronounce words because I'm a little slow. But the next generation NCLEX is a game changer. Hey, real quick, we're doing NCLEX questions. Make sure you guys participate. Make sure you guys share, follow, and give me all them likes. Don't be selfish, all right? Don't troll my chat. If you troll my chat, I'm going to ban you. I promise you, I will ban you. All right. And I'm petty. I'll ban you just because. I got these questions off nurselabs.com. 7-day NCLEX course, $48 for a lifetime. We are uploading. I have 42 videos in there right now, y'all. And if you need one-on-one coaching or tutoring for the NCLEX, that link is also in my bio. And also, we're going to do an AMA after we do these questions. All right. Question 21. Question 20. Game changer for the good, Diamond. It is a game changer for the good. Trust and believe me when I tell you that. All right. Question 21. Lydia is scheduled for an elective splenectomy. Before the client goes to surgery, the nurse in charge final assessment would be what? Signed consent, vital signs, name bands, or empty bladder. What are we thinking? It says Chris here, nurse for 25 years, probably took care now. Thought I failed when I took it and I passed. Shout out to you. A, B, C, and D. Okay. So I failed my NCLEX 3 times, y'all. 3. And I passed it on the 4th during COVID. So I can tell you right now that the way that the NCLEX, in my opinion, now is set up, especially with the case studies where they give you all the information, at that point, it's critical thinking and clinical judgment. And hindsight's 2020. I like the new NCLEX better than I like the old one. All right. 10 seconds, y'all. Here we go. If you guys are new here, we're doing NCLEX questions. Make sure you guys like, share, and follow. Like, share, and follow. You failed your second attempt at 150 questions. Hey, and here's the thing. If you fail your NCLEX, the next thing that should come out of your mouth is, okay, when am I taking it again? There shouldn't be like, oh, I give up, right? We don't quit around here. We are all as people unsuccessfully successful. You will try until you accomplish that goal. All right, here we go. So the answer is B for vital signs. An elective procedure is scheduled in advance so that all preparations can be completed ahead of time. The vital signs are the final check that must be completed before the client leaves the room so that the continuity of care and assessment is provided for. That is reduction in risk potential. Who said I'll never quit? We don't quit. That's right. We don't quit around here. I promise you. People come in here all the time and they're just like, Kevin, I don't know what I'm going to do. I was like, I know what you're going to do. You're going to go and fucking and reschedule that test. Like the hardest thing, in my opinion, about the nursing journey is it's the endurance race of getting into school and then getting through school. The NCLEX is just the last step over that finish line for that marathon. That's it. All right, here we go. Question 22. What is the peak age range for acquiring acute lymphocytic leukemia? Is it 4 to 12, 20 to 30, 40 to 50, or 60 to 70? What are we thinking? What are we thinking? All right. I am preparing as if I didn't take it before, but info from Mark Klimek is contrary to Saunders' book. So that's the thing about NCLEX reviews is that they are all relatively, they all can contradict one another, especially when it comes to ranges, so on and so forth, right? But on NCLEX, if they give you a potassium of 5.1, NCLEX wouldn't give you a question they wouldn't give you a question like that. They give you a potassium of like 6. Like we all know that shit's like way out of range, right? So that's what they would do. They wouldn't they're not going to be tricky. The NCLEX preps that are put out there, even mine that I'm working on, it's meant to be harder. It's meant to be harder. That way, when you roll into the NCLEX, oh, that was easy. That's because you're supposed to practice hard, and you go show out at the game. The game shouldn't be hard. All right, here we go. Here is our answer. It says, I don't know how I passed my electrolyte exam today, but I did. Shout out to you, Banana. Shout out to you, Bananas in pajamas. Hello, first timer here. Failed my NCLEX 3 times. I do not have another chance. It depends on what state. Because if you try to take it, like certain states will allow you to take it multiple times. I know in Texas you have up to 4 years to take it, but you have unlimited, or unlimited time within 4 years. I want to say like New York, you have like unlimited amounts of time. It all just depends on what state that you're trying to take your license in. So the answer was A, was 4 to 12. The peak incident of acute lymphocytic leukemia is 4 years of age. It is uncommon after 15 years of age. It is diagnosed in about 4,000 people in the United States each year, with the majority being under the age of 18. It is the most common malignancy of childhood. The peak age of diagnosis is between 2 and 10 years of age, part of physiological adaptation. All right. 98.6. You almost had we don't need you having a syncope episode. Oh my God. I know, it's crazy. You would think, 4,000, we have like 330 or 50 plus million people that live here. The numbers, one is still too many, but, unfortunately, it's just kind of how the world works, So NYC changed it to 3 times a year. Oh, shit. Okay. See, that I didn't know. I don't live in New York, so I wouldn't know that. All right. So here we go. Question number 23. Marie with acute lymphocytic leukemia suffers from nausea and headaches. These manifestations may indicate all of the following except. Keyword, except, meaning 3 of these are correct and 1 of them is incorrect. So which one does not fit into the clinical manifestations of this disease process? Is it effects of radiation, chemotherapy side effects? Is it meningeal irritation or gastric distension? All right, so shout out to all of y'all that are here, all 200 and 280, 300 of y'all. We're doing NCLEX questions, got them off nurselabs.com. Make sure you guys like, share, and follow. All right, and I want to know who you are, where you're from, where you're at in your nursing journey. Let me Google what states. Yeah, Google the states and let us know, Sandy. CC, thank you for the follow. Is it Gigi? Thank you for the follow. Appreciate you. I'm going to give y'all 10 more seconds. All right. Tennessee, 8 times. Okay, we're going for number 9. My friend diagnosed at 23. Well, that's unfortunate. C, the celestial system. Wow. Okay. I'm not sure about California, to be honest. New Jersey, it's 8 times. Okay. Hey, as a matter of fact, whatever state that you're in, go ahead and Google it and let's see. Let's all find out together. All right. Khadijah, thank you for the follow. Here we go. Here's our answer in 3, 2, and the answer is D, gastric distension. ALL does not cause gastric distension. It does invade the central nervous system, and clients experience headaches and vomiting from meningeal irritation. The primary care provider and nurse practitioner may be responsible for follow-up after treatment and report back to the interprofessional team. These patients need close monitoring as they are prone to infection, coagulation, the dyscrasia, and relapse. That's physiological adaptation. Remember, the 3rd largest section on the exam. Maryland, it says 6 times. Okay. There goes my NCLEX down the toilet. No, stop it. What is the next step after passing NCLEX as an international nurse? So if you pass the NCLEX here in the United States, the next step for you is just a way to get your license, which should be almost immediate, and then you can start applying for jobs. I want to be a peds nurse. I'm quitting. Ma'am, stop playing with me. Stop playing. You can do whatever you want. Facts, you sure can. Tennessee, it's 8 times. Okay. Florida, what about Florida? North Carolina, it's unlimited. All right, y'all, you already know. Everybody go to North Carolina right now. Florida is 3 times in 1 year, and then you have to take a remediation course. That's what I thought. All right, here we go. My son just dropped the trash can, y'all. It's like a normal thing for him, I guess. He loves the damn trash can. Here we go. Question 24. A client is diagnosed with disseminated intravascular coagulation, or DIC. Which of the following is contraindicated with this patient? Is it heparin, Coumadin, treating the underlying cause, or replacing depleted blood products? What are we thinking? Keep climbing. Stay in the don't stay in the same place. Oh, the baby. Yeah, the baby. You hear me back there acting a fool. You know how I do. But shout out to all of y'all who are in here. We are doing NCLEX questions. I got these questions off nurselabs.com. All right. They are free batches of questions. Also, I'm working on my questions right now to be uploaded into my course. It takes time. Hey, it takes time trying to do these things. So I appreciate everybody who has bought the course and who is being extremely patient. So I appreciate you. All right. Tell the answer. No, I'm not going to tell the answer because I just got here. I'm waiting for people to answer. Well, I'm going to get there. I'm going to get there. My God. All right, here we go. Here we go, y'all. Here's our answer. Here is our answer. Camille, thank you for answering. I appreciate you. Here we go. In 3, 2, and the answer is A. Oh, I'm sorry, B. Obviously, I don't know how to read, but it's B. I saw the A, so I said it's B. So DIC has not been found to respond to oral anticoagulants such as Coumadin. Warfarin, which is Coumadin, is contraindicated in patients with hemorrhagic tendencies. With hemorrhagic tendencies. There we go. And then our hemorrhagic tendency, you have active GI ulcerations, patients bleeding from the GI, respiratory or GU tracts. Cerebral aneurysms, CNS hemorrhage, dissecting aortic aneurysm, spinal puncture, or other diagnostics or therapeutic procedures with a potential for significant bleeding. And that is part of risk of potential or reduction of risk potential. Not third, but it's a smaller section on NCLEX from 9 to 12%. Okay. All right, here we go. Question 25. Hey, if you guys are new here, make sure you guys smash that like button. You guys share and you guys follow. We're doing NCLEX questions. Which of the following findings is the best indication that fluid replacement for the client with hypovolemic shock is adequate? Is the urine output greater than 30 mLs an hour, respiratory rate of 21 per minute, diastolic blood pressure greater than 90, or systolic blood pressure greater than 110? What are we thinking? Hey, okay. I don't know why I scream like that. Hey, keyword. What is the key word in this sentence? What are we thinking? What is the key word in the question? What is the key word in the question? Adequate and best. Okay. Weight is an indication of imbalance. What? That's true. Fluid volume replacement, hypovolemia, fluid, right? But hey, the key word in here is best. It's even highlighted. So what is the best out of all of them? If I could pick one, which one? If I could pick one of these things, what do I want it to be? Iowa has unlimited testing for the NCLEX. Okay, damn. I ain't never been to Iowa. I heard it's kind of nice up there. Except for during the wintertime. I don't do cold like that. Like it's 48 degrees here in San Antonio. I just don't know why God did this to me, okay? I was more worried about their shock, but maybe I'm thinking too hard. Well, Victoria, we about to find out. We about to find out. All right, here's our answer. Is it Evelyn? Thank you for the follow. Here we go. Here's our answer, y'all, in 3, 2, and the answer is A, a urine output greater than 30 mLs an hour. Urine output provides the most sensitive indication of the client's response to therapy for hypovolemic shock. Urine output should be consistently greater than 30 to 35 mLs an hour. Renal losses of salt and fluid can lead to hypovolemic shock. The kidneys usually excrete sodium and water in a manner that matches intake. Diuretic therapy and osmotic diuretic or diuresis for hyperglycemia can lead to excessive renal sodium and volume loss. In addition, there are several tubular and interstitial diseases beyond the scope of this article that can cause severe saltwater nephropathy. All right. Nurse Kev, do you recommend going straight to a job after passing the NCLEX or taking a break? You better take that ass and get a job. You better go get a job. Go get a job. J-O-B. Go get a job. Unless you don't want to go get a job, then don't go get a job. But I would recommend, getting out there and putting those skills to the test. Wanted to be a nurse. I'm just here for fun to see if I can get the answers right. Mara, I appreciate you being here. The loans will be kicking soon. Oh, I bet they will. Shani says, I've been a nurse RN for 15 days. I literally thought you were about to say 15 years. I was like, have you really? Hey, here we go. Hey, we're doing NCLEX questions. Make sure you guys participate. Participation is the key. I want all the participation down there at the bottom in the chat. Okay, give me all them likes. Make sure you guys share. Make sure you guys follow. Okay, don't be selfish your whole life. Hey, if you troll my chat, I'm gonna ban you. Hey, if you rush me, if you're gonna try to rush me and tell me to go to another question, put a smiley face after it so I know you're not trying to be rude to me, because I'm working on a lot, okay? I'm working on myself. Hey, but don't be rude in my chat. If you're rude in my chat, or if anybody tells me, I'm going to ban you. I'm going to give you a 600, okay? Nurselabs.com is where I got these questions. These are free batches of questions, y'all. Y'all can go there at any point in time and look them up yourself. 7-day NCLEX course, that's my course. The link is in my bio. It's for $48. It is going up to $97 after Cyber Monday. I promise you. I promise you that, okay? So make sure you guys go over there and check it out. And you get it for a lifetime, so just letting you know. So if you're an LPN going for RN, it works for both, all right? And if you need one-on-one tutoring or coaching for NCLEX, that link is also in the bio, and we're going to do an AMA afterwards, okay? It says, hurry up, we need the next question. Camille, you about to get banned. What'd I tell you? You know better. You You. I ain't gave nobody the finger in a long time, Camille, and you got the finger. All right. So don't you know better? Here we go. Question 26. Which of the following signs and symptoms would Nurse Maureen include in her teaching planning as an early manifestation of laryngeal cancer? Is it stomatitis, airway obstruction, hoarseness, or dysphagia? It's blurry. That's because I have my finger in front of it. My bad. There we go. I fixed it. Guys. I fixed it. I'm legally blind. I can't see. My bad. Oh my goodness. All right, here we go. What are we thinking? Dysphagia. Okay. POP, holding it down. Is this helpful for EMT and paramedic stuff? I would think so. I mean, I would think any type of medical information would be helpful in any aspect, right? What if you deal with somebody who has laryngeal cancer that you go pick up and then you got to go intubate them? Not saying that you would need to know all the health and history like that, but, you might need to know all the little health and history about that. Had my med surg exam today. I'm tired of this. My bad. My bad. But yeah, I would think all information it's helpful information. The indicating word is early. There you go, Chris. All right, y'all, here we go. Here is our answer. In 3, 2, and the answer is C, hoarseness. Early, like Chris said, that's an early sign, right? So early warning signs of laryngeal cancer can vary depending on the tumor location. Hoarseness lasting 2 weeks should be evaluated because it is one of the most common warning signs. Patients are typically male with a history of current or past tobacco smoking. Hoarseness is often an early presenting symptom of glottic cancers due to vocal cord immobility or fixation with pain with swallowing and referred ear pain indicating advanced disease. That's part of physiological adaptation. Third largest section on NCLEX. Hey, it's very important that you guys read your rationales, okay? I can't put my finger in front of here because if I do that, it's going to get blurry. And then I'm going to be like Camille about to get a 600, all right? Here we go. Question number 27. Karina, a client with myasthenia gravis, is to receive immunosuppressant therapy. The nurse understands that this therapy is effective because it promotes the removal of antibodies that impair the transmission of impulse. It stimulates the production of acetylcholine at the neuromuscular junction, decreases the production of autoantibodies that attack the acetylcholine receptors, or it inhibits the breakdown of acetylcholine at the neuromuscular junction. What are we thinking? Hey, if you guys are new here, we're doing NCLEX questions. We got them off nurselabs.com. Make sure you guys just smash the like button. Get carpal tunnel smashing the like button, all right? Make sure you guys make sure you guys share, make sure you guys follow. You never know who's going to need this, okay? And I want to know who you are, where you're from, where you're at in your nursing journey. Or if you're not a nurse, what brings you here? Where you at in your life? We want to know it all. I just passed my NCLEX. Danielle, you passed your NCLEX on the 17th. Everybody shows Danielle some love while you're answering. Tell Danielle that you are proud of her. And tell her because you are proud of her, not because I'm telling you to do that. But do it anyway, all right? Give her hey, congratulations to you. Welcome to the shit show. Welcome to the shit show. I'm very proud of you. Now you're going to go out there and do great things as a nurse. You passed too? Oh, Shani, we already said that you passed. Well, we can give you love too, baby. That's what we do out here. You know what I'm saying? Everybody give everybody love for passing, all right? Congratulations to everybody, for real. All right. Hey, because and let me tell you something right now, y'all, if you're going to be a nurse, you are definitely needed. You are definitely wanted, and you are definitely loved by your peers. I promise you that. All right. I don't give a fuck what these news outlets say. I don't care what these people are doing. I don't care what type of bad limelight they're trying to put nursing in. Like, y'all are loved and appreciated around here because at some point we all got to do it if that's where we're trying to go. All right, here we go. And the answer is C, decrease the production of autoantibodies that attack the acetylcholine receptors. Steroids decrease the body's immune response, thus decreasing the production of antibodies that attack the acetylcholine receptors at the neuromuscular junction. Immunotherapy is used to upregulate or downregulate the immune system to achieve a therapeutic effect in immunological mediated disorders, including immunodeficiencies, hypersensitivity reactions, autoimmune diseases, tissue and organ transplantation, malignancies, inflammatory disorders, infectious diseases, and any other disease where immunotherapy can improve the quality of life and expectancy. I'm like, that was a mouthful and I read it all. kind of in one breath, but physiological adaptation, third largest section on the NCLEX. Make sure you guys are reading your rationales. All right, make sure you guys are reading them. Thank you, Sandy, for the rose. I appreciate you. I'm an LPN for 13 years looking to go for my BSN. Yes, ma'am. Go make that happen. Go make it happen. Here we go. Question 28. A female client is receiving IV mannitol, right? An assessment specific to safe administration of the drug, of the said drug, is what? Vital signs every 4 hours, daily weights, your hourly urine output, or level of consciousness every 4 hours. What are we thinking? What are we thinking? So this is where you use your, your critical thinking, your clinical judgment. You got to think of, what is mannitol used for? All right. So whatever the disease process or whatever the ailment that the patient is presenting to you, you paint the picture. That's what I call, you paint the picture for yourself. There you go. There you go. I'm gonna give y'all 15 seconds. Okay. 15 seconds. We got some C's, we got some D's. Hey, if you guys are new here, we're doing NCLEX questions. So welcome. Make sure you guys smash that like button. Make sure you guys share, and make sure you guys follow. Got these questions off nurselabs.com. All right. Here we go, y'all. Here we go. Here's our answer. Here is our answer in 3, 2, and the answer is C, urine output hourly. The osmotic diuretic mannitol is contraindicated in the presence of inadequate renal function or heart failure because it increases the intravascular volume that must be filtered and excreted by the kidneys, right? Urine output also requires monitoring. Failure for urine output to increase after administration of mannitol should prompt cessation of mannitol and evaluation for possible renal or, genitourinary issues. Wow. I could not find the words for that. Lord have mercy, let me tell you. But pharmacological and parenteral therapies, all right? Second largest section on the exam. I want to save lives. I know that's right. I thought you said you wanted to save these lives. I was like, hey, so all the lives that I do, they will go up on YouTube, okay? So they will go up on YouTube. Here we go, question 29. Patricia, a 20-year-old college student with diabetes mellitus, requests additional information about the advantages of using a pen-like insulin delivery device. The nurse explains that the advantages of these devices over syringes include accurate dose delivery, shorter injection time, lower cost with reusable insulin cartridges, or use of a smaller gauge needle. So shout out to all 200 plus of y'all that are in here rocking with me. It's almost an hour and a half that we've been doing these, y'all. Almost an hour and a half. So I appreciate everybody being here. We're doing NCLEX questions. Got them off nurselabs.com. Make sure you guys like, share, and follow. Like, share, and follow. That helps the TikTok algorithm. All right. And make sure you share because you never know who's going to need it. And then make sure you follow me because I'm kind of cool sometimes, but whatever. But yeah, I want to know who you are, where you're from, and where you're at in your nursing journey. Thank you for doing these. Ma'am, you are very welcome. I do these every Monday, Wednesday, and Friday at 5:30 Central Standard Time. We appreciate you giving us your time. Sandy, you always here, girl. You already know what the deal is. You know what I'm about. You know what I'm about. I don't know how to show a like. You just got to tap on your screen, and then you'll start to see those little hearts go on the side, and that's how you like the stream, okay? All right, here we go. And our answer is A, accurate dose delivery. These devices are more accurate because they are easy to use and have improved adherence to insulin regimens for young people because the medication can be administered discreetly. Once in use, most insulin analog vials, cartridges, and pre-filled pens must be discarded after 28 days. This means that many patients who use a 10 ml vial end up either wasting insulin or using insulin beyond its recommended discarded date. This is rarely a problem for patients using either a 3 ml pre-filled pen or a reusable pen containing a 3 ml insulin cartridge. That is health promotions and maintenance. It's because it's an education question. You have a patient who is wanting to know more about how they can use something and why it's more effective. So health promotions, education. Okay. I wish we could do study buddy groups. You guys can do amongst yourselves. You guys can do study buddy groups all you want. But if anybody wants one-on-one, studying where we go through questions, answers, you get a tracker, you get a calendar, you get all that other stuff, then, you can check out that link in my bio. I do that all the time. So I actually had a guy who messaged me and who left a comment on one of them saying that he just passed his NCLEX on the 26th. So I'm super proud of him from using the program. And the program's only in this pre-launch phase. So he comes to these and he has my program. So it's super helpful. All right, y'all, here we go. Question number 30. A male client's left tibia was fractured in an automobile accident and a cast is applied. To assess for damage to major blood vessels from the fractured tibia, the nurse in charge should monitor the client for what? Swelling of the left thigh, increased skin temperature to the foot or of the foot, prolonged reperfusion of the toe after blanching, or increased blood pressure. What are we thinking, y'all? What are we thinking? What are we thinking? Everybody's screaming C at me. C. Banana really screaming C. Well, all right. Is it Fabian? Fabian or Fabian? Thank you for the follow. You think it's C, Sandy? Okay. All right. My RN wife says C. Okay. Tell your RN wife I said okay. We about to find out what the answer is. Capillary refill. Is it Kima? Is it Kima? Did I say that right? Kima, thank you for the follow. What do you need to score on the NCLEX to pass? So the NCLEX is not based off of a 0 to 100 score. It's based off of a computer adaptive test, like an algorithm, based off of the level of type of questions that you're answering, based off of their correct or incorrect. Okay. So like if you're practicing, you can think of it as I need to score above a 50%. Think about it of scoring above a 50%. RT here and it's C. Okay, Brandon. All right, but yeah, and the answer is C. Prolonged perfusion of the toes after blanching. Damage to blood vessels may decrease the circulatory perfusion of the toe. This would indicate the lack of blood supply to the extremity. If the intercompartmental pressure becomes higher than arterial pressure, a decrease in arterial inflow will also occur. The reduction of venous outflow and arterial inflow results in decreased oxygenation of tissues, causing ischemia. If the deficit of oxygenation becomes high enough, irreversible necrosis may occur. That is part of reduction of risk potential. All right. So remember, you guys are always reading, always reading your rationales, whether you got them right or incorrect. Okay. Because that is how you are able to continue the learning and retain the information. Okay. So shout out to all 200 plus of y'all that are in here rocking with me. All right. And ladies and gentlemen, that is it for the questions. I appreciate everybody jumping in here. I appreciate everybody participating. I only had to ban one person because they were trying to send me nudies. Why send me nudies that I have to pay for when I can get them for free? What's wrong with y'all? Anyways, hey, I appreciate everybody. I appreciate all the love. I appreciate all the likes, the shares, and the follows. I really do appreciate it because you have no idea who this is really helpful for, right? Once again, I don't gatekeep. I got these questions off nurselabs.com. Okay. 7-day NCLEX course that's in my bio, one-on-one coaching that is also in my bio. Now we can talk about the AMA. Thank you. This was pretty cool. Can't wait for next time. Thanks, buddy. You're welcome. I'm gonna turn this camera around so you guys can see my disgustingly hideous face. What's up, y'all? How y'all doing? I'm waiting for somebody to tell me that I look like Jason Derulo, but But there we go. The next session. Yes, the next session is on Wednesday. My hair is looking kind of funky right now, but what's up, everybody? How y'all doing? Do you think it matters the testing center that you go to? Jocelyn, I don't. It does not matter the testing center that you go to. What's up, Sandy? Sandy, you got all the jokes. Kima, thank you for the heart. I appreciate you. What time? Is it Chantel? It's Monday, Wednesday, and Friday at 5:30. All right. What's up, Matt Singer? Hey, how are y'all? You came late. Yeah, we just finished. Literally just finished like 30 seconds ago. So, hey, every live that I do, it's going to go up on YouTube. So if you guys don't follow me on YouTube, that link is also in my bio. Kansas gives you how many chances? I don't know. You tell me. What's good, bro? What's up, Jay? How are you, sir? It's been about a week since I seen you up in here. So Jay is on his CRNA journey. He's almost there. Almost there, good sir. Wait, are you already a CRNA? I think we talked about that. Okay, you're so helpful. LOL. Okay, you're welcome, Chantel. No problem. Okay, I'm definitely watching your YouTube. Yeah, I got all of these lives are on YouTube. All right, and they usually go up at about 10 o'clock every day, every other day, or whenever I have them scheduled. What time and days do you do this? Great way to review. Monday, Wednesday, Friday. And you can check that out in my bio as well. I'll go to your YouTube. I'm an immigrant. I'm struggling. Vicky, is it like a language barrier for you? Do you think the NCLEX is harder when taking it for the second time? The NCLEX is going to be hard if you don't prepare for it correctly. right? So I always thought the NCLEX was hard, but then once I started practicing and doing what I needed to do for myself, like I promise you, it became easier. Still in school, that's what I thought. I'm a new classmate. I'm a new classmate now. Oh, okay. Oh, are you a new classmate? That's what I'm talking about. Thanks for your help. You're welcome. Wow. I aspire to be a CRNA. I wanted to be a CRNA, but then I realized that just wasn't in the cards for me because I honestly, and one of the things is just like my passion of going to be a CRNA wasn't there anymore. I really love teaching, which is why I do this. Vicky, where are you from exactly? If you don't mind me asking, what's the website? You got the questions again? I got these questions off nurselabs.com. This was my first time joining. I will definitely be committed. I appreciate you. Thanks for being here. Where are you located? I live in Texas. Say, and so I can go. I am not. Say ARMY. Sir, I will not. I will not say it. You will not rope me into saying that hideous word. How is the NCLEX different from the Canadian NCLEX? There's really no difference. There's really no big difference. Unless they start to ask you cultural things, depending on where you are in Canada, because I know Canada is a very big, depending on where you are, very big French population, and depending on, different culture aspects, but there's really no big difference for the NCLEX. Is it better to do LPN first or go straight RN? That depends on you and depends on what your pockets look like. I know people that are LPNs, been LPNs for 20 years and they love it, so it depends on you. It depends on what you want to do, so. When are you getting sponsored? Hey, I actually do have a brand partnership with Picmonic, so I do have that. But I'm trying to work on some shoe deals with people, man. Give me them nursing shoes so I can sport them. You know what I'm saying? What's the biggest advice for taking the NCLEX? I take mine very soon. Well, for Ashley, here's what I'll tell you. Oh, you got the 7-day NCLEX course? That's what I'm talking about. Yes. Hey, we about to put. Hey, I've been on the phone with a bunch of people all day today, getting some stuff taken care of and get some stuff in there. So I'm letting y'all know we got the reviews and stuff are about to be posted up in there. So for you getting it for $48, I'm trying to tell you, chef's kiss, right? It's a diamond in the rough. I promise you. The biggest advice I would say is to recreate the testing center. Keep everybody out your face. Keep everybody out your face. You really know what type of friends that you have when you are studying for the NCLEX and when you're going through nursing school. So one of my biggest advices is just to keep studying, cancel out all the noise, and just keep preparing the way that you're preparing. Okay, thank you. See you Wednesday. Alrighty, see you on Wednesday. I've been an LPN for 16 years, going for my RN NCLEX by February. I know that's right, Sandy. Sandy, we talk about that all the time. Third semester nursing student here. I'm so close to failing my peds. Any advice for passing? So Amber, I would ask you, what type of learner are you? So think about how you learn and how you retain information. That's honestly, that's one of the biggest issues that people have is like, what type of learner are you? Once you figure out the type of learner that you are, study that way. So if you are a read-write and you like to read the book, or if you like to see PowerPoints and you like to write them down, then do that. Are you an auditory person? Do you need little ditties to help you remember specific things? All right. So it just depends on you and how you retain information. But one of the biggest things that I always tell people is, or I ask, what type of learner are you? Okay. Let's say, Kima, what time? I'm guessing you mean what time is my lives? They're 5:30 Central Standard Time, Monday, Wednesday, and Fridays. Stephanie said, what would you do okay. So he said, yes, you would go. Stephanie, I don't even know what you even just said. Also, advice for picking a specialty. Okay, Amber, where do you want to go? This is true. I'm an audio video. Okay. How long it take to be an RN? It depends on what is it Edna? Edna Mode and friends. I'm just playing. But it honestly depends. It depends on what school you go to. Depends on how much schooling you have. It took me 8 years to become an RN. It took me 8 years. I started my journey in 2012. I went on a deployment to Afghanistan, came back, was doing classes, all that stuff. So I didn't get my license until 2020. But it all just depends. It depends on you and what you have going on in life. On average, to become an RN, it could take anywhere from 2 to 4 years. 2 to 4 years. But anyways, shout out to everybody that's here. I appreciate everybody being here. My name is Kevin. I go by the Boot Nurse on all social media platforms. You can check me out on Instagram. You can check me out on YouTube. Of course, you're on TikTok. Make sure you guys follow. I'm actually going to be dropping some TikToks later. You know what I'm saying? So, but yeah, I want to know who you are, where you're from, where you're at in your nursing journey. If you're not a nurse, what are you doing with your life? Why are you here looking at me? You know what I'm saying? So, yeah, whatever question you guys got, drop them. Let's say I'm a new subscriber. Welcome. Is it Anyi? Is it Anyi? Did I say it right? Let me know if I said it right. Best advice any seasoned nurse gave you for getting through school or the field. Oh, so one of the best advice is to ask questions. Doesn't matter how upset they are. Ask questions and ask questions until you understand it. Because in the end, it is your license. In the end, it is your license. So if I don't ask a question, no, you didn't say it right. Damn. I tried. Okay. But yeah, don't let people play with your license. That's one of the biggest things. So always ask questions. Always ask questions. That'd be the biggest advice that one of my mentors, who was a 25-year Army vet, 15-year ICU nurse. Don't let people play with your license, and always ask questions. Always. Is it different for every state? I'm from Georgia. What do you mean, Chantel? Is what different? I'm going to take my NCLEX next month for LVN. Shout out to you. New to the page. What does your course entail that you're offering? So my course entails tons of content. Right now, I'm projecting about 150 content videos to include a new generation NCLEX review, as well as the 7-day NCLEX review, which is going to take, I'm going to break it down by day, where I'm going to go through the 8 sections of the NCLEX client needs. So management of care, pharmacology, so on and so forth. Those are in production right now. One is being edited right now, and it should be up here within the next week or so. So, and if you go to my website, it'll tell you everything that's being offered in there. Okay. Let's see. LPN second. Okay. Shout out to you. Buffalo, New York. I know it's cold up there. And do not pretend you know something, Chris. Let them know. If you don't know anything, you better open up your mouth and say it, because look, somebody almost gave somebody 20 units, 20 or 2 or 1 ml of damn insulin when they needed 1 unit of insulin. You know what I'm saying? I'm in California. I feel like I don't understand. What is it that you don't understand? Hold on. I'm trying to make sure I'm going to take. Okay. So you're going to take. Okay. So what is it that you feel like you don't understand? I don't know how to pronounce your name. I don't want to butcher it. So do you have anything for nursing nutrition? So I actually have, I'm working on a nutrition lecture right now. So can't wait to buy it. Hey, you already know it's there for you. You know it's there for you. What, Chantel? What I forget? Why is it that in nursing school they don't teach you on how to communicate with doctors? That's a very good question. I wish I could tell you. Because you're supposed to. That should actually be one of those things. They always say, hey, be prepared to talk to these doctors, yada, 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 blah, 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 blah. But they don't do the scenario. You know, I would really love to do the scenario as in like, hey, this is how you should communicate with a doctor. Because some doctors, I'm telling you, that's actually one of the biggest things that makes people nervous is the communication with physicians. But therapeutic communication, which is a class depending on, where you're at in your nursing journey, that's one of them, of communicating with them. And when you communicate with them, a lot of the doctors, hell, even some senior nurses or seasoned nurses forget where they come from. So yes, make a video. I got you. I'll make a video. Exactly. So true. Doctors can be nuts. Yeah, doctors can be nuts. They can. I've literally seen some doctors come up there and cuss people out. And I had to think, I forgot where I was. I was just like, oh my God. Oh, we're in the hospital. Okay. Because I thought he was talking to me. I know he wasn't talking to me. So some doctors forget you'll see them in the grocery store. You know what I'm saying? They may slip and fall. No, I'm just playing. I'm just playing. But yes, Sandy, that's definitely on the list of things to do. I saw one throw the computer. Ain't no way. So how do you feel about travel nursing? Would you recommend? Absolutely. 100%. The one thing I'll tell you about travel nursing, though, before you do that, is you want to be somewhere where you want to be somewhere for at least a year to 2 years to get your skills down. Because when you become a travel nurse, listen to me when I tell you, the staff nurses, majority of them are not going to like you because you make more money than them. And 2, the whoever the charge nurses are, which are this profession is 98 or 89% women, they will throw you to the fucking wolves. They will give you the shit show of fucking patients, and they'll be like, "Oh, you're making more money than us, and here you go." The travel nurses that I had, I loved them. They were fucking great. Almost every single one of them, they were awesome, and they taught me a ton. Taught me more than a lot of the staff nurses did. So I would recommend it, but I would definitely recommend getting some time under your belt before you do that, so you don't play with your own license. You know what I'm saying? Please make a video. Sometimes I kind of feel intimidated by talking to them. Okay, we can do that. I can do that. I'll jot that out. So a nutritional video, which is already coming, and then how to communicate with doctors. I got you. Hi, tips around how to study pathophysiology and pharmacology. Or next to them in church. Ain't that crazy? How they talk and cuss people out, Chris, and the next you go to church and you're just like, hey, I remember what you did yesterday. They're human beings too. They're right. They are human beings. They are human beings, but those human beings that are doctors don't need to be treating other human beings like we ain't human beings either. Chris, thank you for the follow. I appreciate it. They expect you to know everything. Nah, that's the thing. It's just like, I'll tell them, I flat out told them, like, you know what? I'm not sure about that because I don't. And no part of me cares. Like at some point, you're just like, you know what? I don't know. You can't be a person out there saying, yeah, you know everything, because then they're going to expect for you to know everything. And then guess what? When it doesn't happen the way that you say that it's supposed to happen, they're going to be like, well, you said that you knew this. And then it's fucking up shit's creek at that point. Yep, giving them the stink eye in the house of the Lord. Let them know. They'd be like, hey, you can try Jesus, but not me, right? But somebody asked a question about pathophysiology and about pharmacology. Pharmacology is all about knowing the family, like the family of which the drugs fall under. I will always use I will always use cardiac meds. So when you're studying cardiac meds, you want to know the family name, the suffixes. So what falls under cardiac meds? Okay, we got our ARBs, our ACE inhibitors, our beta blockers, calcium channel blockers, so on and so forth, right? What is the suffixes for the end of those? All right, cool. So now that I know the suffixes for the end of those, I know now these are cardiac meds. What are the signs and symptoms? What are the side effects? Like lower blood pressure, lower heart rate, increased preload, increased afterload, vice versa. Will it eliminate potassium? Will it keep potassium rolling in my body? What are the potassium levels? Like what are the normal ranges? Those are the things that you got to look for. There's so many YouTube videos that are out there, YouTube channels that are out there that are so good with patho and pharmacology. And I know Nexus Nurse is one of them, on top of Khan Academy, which is great. And there's a bunch of them that are out there. I usually have a list and I don't have them up here with me right now. But I would definitely look at YouTube. I'm telling you, YouTube. You can find so many great YouTube channels out there that can help you with those. It says, what is the strategy to pass basic care in comfort and psychosocial section? Are you talking about on NCLEX? Honestly, when it comes to with psychosocial, that's about therapeutic communication. Like in my humble opinion, therapeutic communication, as well as the effects of psychiatric medications, knowing the like when they take their effect and when they're not effective, what you need to do. You got to think like, what is it? I want to say 1 to 2/3 of people of psychiatric medications not working is non-compliance. People that are non-compliant. So those are things to think about as well. And with basic care and comfort, that goes all the way back to fundamentals. Right? So, what is the basic care that, you need to, like, turning your patient every 2 hours, preventing other injuries like pressure injuries, answering your call light, watching a patient, who may have, dysphagia, right? When it comes to like, hey, who gives the first feeding, for somebody who has dysphagia or anything like that, so think about those things too. Let's see. Learn only generic names for NCLEX. That got me. Yes. So on NCLEX, they will not say, hey, you have a patient who is on Lasix. They won't say Lasix. They will say furosemide. If they say furosemide, they may have Lasix in parentheses, right? But at the bare minimum, they're only going to give you the generic names when it comes to your medications on NCLEX. Okay. Basic care and comfort is essentially what you want someone to do for your mama if they were your nurse. Facts. Let them know. That's right. Basic care. Like, what are the basic things? What are the basics of the basics? Answering the call light, getting them water, turning them every 2 hours so they don't get pressure injuries. Like I said, right? Activities of daily living, basic care. What is the basic things that I could do to take care of you? All right. I know that sounds easier said, but essentially that's what it all boils down to. Okay. Hey, but shout out to all 70 of y'all that are in here rocking with me. We went over NCLEX questions. We do these every Monday, Wednesday, and Friday. Make sure you guys go over there and check out my YouTube, because this live will be up there at some point. How can you answer next gen on NCLEX? So is it Rugi? All right. So here's the thing about new generation NCLEX. The content within the NCLEX has not changed. It is the delivery of how the questions are being delivered to you. That's it. So you're still going to have select all that apply by itself. You're still going to have, your click and drags where you put things in order. Still going to be there. You're still going to have your multiple choice. Still going to be there. Now, the different delivery methods of how they deliver the questions, such as your case studies. And within your case studies, you can get 6 questions based off of one case study. Okay. And with that case study, they can ask you, hey, what are the important things? What are the 5 important things from this case study? So you click them. So there goes a highlight question. Then within that question, they can give you, hey, based off of everything that was in this case study, what do you anticipate or not anticipate the nurse to do? So then you click those, right? You click them. And then they have another one such as, the close or the drop down. Those are like the fill in the blanks, right? With the fill in the blanks, you essentially pick the ones that make sense. That's another question type. All right. And remember that select all that apply questions are now partial credit. And then you also have your bow tie questions. Yep, that's right. So your bow tie questions, it'll tell you like, what do you think the diagnosis is? What are the actions that you take? And then what are the priorities, right? What are the priorities that you do or that you watch out for? What are the actions that you take, so on and so forth. All right. So Literally, I have seen people take select all that apply questions and then turn it into a case scenario and then put it out there. Right. And then you have to know based off of your clinical thinking and your critical thinking and your clinical judgment as you go forward, they will throw, they'll be like, hey, here's an update. Like your patient came in at 7. It is now 10 o'clock. Here are your patient's updated vital signs. Now what do you do? Does that make sense? So essentially, the case studies kind of take you through a 12-hour shift of, if you have a patient who's good to go and now your patient's starting to decline, what do you do? Or if they start to improve, what do you do? Right? Any tips for studying medications? I've been introduced to meds. I have just been introduced to meds in nursing school. So like I was saying about meds with pharmacology, you want to know your family name and your suffixes. Flashcards are a really good way. For you to essentially it's memorizing because you need to know what those medications are and where they fall under, right? So they have really good YouTube videos that are out there, of course, like Khan Academy, Nexus Nurse, PharmD, or is it PharmMD? I think is one, or PharmD. Simple Nursing has a really good pharmacology videos that he posts up there. So I would definitely check those out as well. I am gonna hang out for about another 10 minutes. So shout out to all 50 of y'all that are rocking with me. I appreciate all the shares. I appreciate all the follows. And I just want to let y'all know, y'all will hear me say that we are unsuccessfully successful here, right? I took my NCLEX 3 times, y'all. Three. Once in 2018, twice in 2019. And then I took it again in 2020 and I got my license June of 2020. You see what I'm saying? It's just like nobody would ever know. Nobody would ever know I failed my NCLEX unless I told you. And no part of me cares what anybody thinks when I tell them that. Have a good night. See you Wednesday. All right, Sandy, have a good night. I appreciate you. Who's that? User 66. I appreciate you. And so that's what I'm saying. It's just like people are going to do a bunch of this, especially when they're not walking the same line as you are. You see what I'm saying? Lillian, I appreciate the follow. Thank you. So go out here and walk your journey. Go out there and do what you need to do. You're going to be unsuccessful at it. That's the whole thing about the learning process. That is the whole thing about the learning process when you're trying to do something new. I promise you. You're going to fail. You're going to get up. You're going to audit yourself, see what you didn't do well on, and now you're going to proceed. You're going to fail. You're going to do it again. You're going to fail. You're going to do it again. Then eventually you're going to accomplish it. And you're going to be like, well, shit, it wasn't that hard. But, if it took those unsuccessful attempts for you to become successful, which is why I say we are unsuccessfully successful around here. All right. Thank you for sharing your knowledge with us. You're welcome, super cute walker, like a day walker. No, I'm just playing. I got you. I appreciate you being here. Derek says, thoughts on community college nursing degree. Get it. Get that nursing degree. Because let me tell you something. Here's something that I want people to not be so confused about is that the RN, a registered nurse, that is a license. Now, your ADN and BSN, those are degrees. I've heard people say, hey, I'm trying to get my RN and then I want to go get my BSN. I was like, you can get you're trying to get your ADN as a registered nurse, and then you're going to go and get your bachelor's degree as a nurse. Those are two different things. Okay. And I don't want people to get confused on that. If I could go back and do it all over again, I would have went to a community college just like you were asking, Derek, and I would have gotten my nursing degree and license that way. And then I would have worked my way up, like doing an online class, because I would have been a nurse for way earlier than I was. But, hindsight's 2020. You don't know what you don't know. Now I know. So I tell y'all about it. So I tell everybody, if you can go to a community college, as long as it's accredited and they have, in my opinion, have a good NCLEX pass rate, it's a no-brainer. That is a no-brainer. All right. But what else y'all got? What other question you got? Got my ADN and got the hospital to pay for my BSN there. And that's another way to do it too. So sorry if you guys hear my son screaming. I think it's about that time. And he's a brat. I'm just saying he's a brat. Don't waste your money. What you mean don't waste your money? I got my ADN. I got the hospital to pay for it. Oh, you're talking about don't waste your money trying to get your BSN, have the hospital pay for it. Got you. No doubt. Hella cheaper than 4 years at a top university. And you want to know the crazy thing about it is that when you start working in a hospital, no one's going to know that you have a 2-year degree. No one's going to know. They're going to know. How would they know? They're not. I said I would have had a lot more debt without the military. Facts. I have a bachelor's degree, working on my master's right now in education. No school debt. However, I did have to pay. People are under the assumption that it's just given to you, but that is not the case. You do have to pay for the GI Bill with money and your mental health. I'm just saying, you got to be in the military in order to make that happen. So I'm just saying there are things that you do have to pay, even though they may not seem monetary right up front, but you do pay for it. Trust and believe me when I tell you that. Most ADNs have more clinical. No. Maybe. I guess it just depends. But I said I've met many nurses that have their ADNs and that are phenomenal. It says ADNs have more clinical skills than BSN. BSN has more evidence-based practice. I guess, yeah, because when you get your bachelor's degree, the second part about your bachelor's degree is definitely doing research. Research is definitely one of the biggest classes when you are going for your bachelor's degree, for sure. I can't really say that about myself. I'm a hospital corpsman. I've been a corpsman for 16 years, so I have the clinical skills when I went straight into my bachelor's program, but that's different for me, how it is, I guess, for the majority of people. So I could agree to that. Agreed. I like the education I got from both the military and my university. Shout out to you, Chris. What branch of the service were you in, Chris? But hey, if you guys are rocking, I'm going to hang on for about another 5 minutes. I just want to answer some more questions that you guys have in regards to nursing. And then I'm going to hop off and then we'll jump back on here on Wednesday. So what else we got? Army Nurse Corps. Ew. Oh my God. If Jay was here and he heard me say Army, he would be like, yes, he finally said it. I worked with some Army Nurse Corps officers. Like I said, I'm in the Navy. My whole military career have been Navy Nurse Corps officers. I thought about being an Army Nurse Corps officer just so I could go do flight, but then I was just like, no, I don't want to do that no more. So, and I applied for packages, but now I'm just like, I don't want to do it no more. I've been applying for officer packages for the longest time, and I've been getting denied. So now I'm just gonna retire. I'm just gonna retire as an enlisted man and just go on by my business. Would you go for your MSN? Yeah, absolutely. A master's in education for sure. Would you consider nursing to have a high fulfillment rate? I don't want to do it just to not like it. Derek, that is up to you. To be completely honest, it depends on what you consider to be a high fulfillment. I can tell you right now, I have had some really fucking crazy experiences working as a nurse, working in a burn ICU, a medical ICU, a neuro ICU, on top of working in a PACU and working in an OR. And I've seen some crazy shit. But the fulfillment of seeing somebody go from point A to point B, meaning from being at their worst to being not completely better, but increasing in their living and being better. Loved it. Like there's no better feeling. But then, on the opposite side, you have people that are really good and then they die within a couple hours, so it is very subjective. So then you would have to find a specialty. And let me tell you something, once you become an RN, it's like the floodgates open to where there's so many different spots of being a nurse. Like being a nurse does not mean that you have to work bedside. Listen to me when I tell you this. Just because you are a nurse, either be an RN or an LPN, does not mean that you have to work bedside. I know nurses who haven't worked bedside in 10, 15 years, and they do nursing research or they do something else with their license and they completely love it. So it's very subjective, and it's where you want to apply your license. So Chris said, thank you for your service. I appreciate you. It's always nice to see fellow vets in here, vetting each other. If that's the thing, whatever. So I took my NCLEX. I took NCLEX many times and failed. So discouraged. Okay, is it Esmerine? Esmerine. I don't know how to say your name. I'm fucking it up, and I am so sorry. So you failed it many times, and you're discouraged. Why are you discouraged? Now here's a question. I'm going to ask you this one specifically. What did you not do? Because remember, everything is your fault. Yes. When I say everything is your fault, everything is your fault. Did you not study properly? Did you not ask for help? What was your time management look like? What was your accountability look like? Do you not understand questions? Do you not understand the content? Do you not understand both? You know what I'm saying? What was your environment like? Were you trying to study while you were watching TV? Were you trying, were your kids there? If you have kids, do you have a good support system? Like there are so many things that go into that. So, and it's no shade again. It's no shade on you because I had that same problem. I had that same problem. So in the end, it's your fault. So now my question is, you feel discouraged. How are you going to fix it? How are you going to fix it? I signed up for LPN. Is the test hard? What do you mean? Is the LPN NCLEX hard? The NCLEX is hard regardless. I don't care what nobody tells you. It is a difficult test. If it was an easy test, everybody and their mama out here would be a damn nurse. All right. I worked bedside for 5 years. Now I do school health and make more money and have less stress. I know that's right. Is it true that it is very easy to get hired as a new grad these days? So Stephanie, what a lot of these hospitals are funneling new grads into residency programs. That's why it's so easy. I'm not gonna say easy, but that's why it's easier to get a job. Because in reality, do I believe that all nurses should go out there and get the bedside aspect to get their skills? I do, because it does make you marketable. Because I know a girl who got a year of nursing bedside experience, and then a year and day one, she went and started working as an aesthetic nurse. She was like, oh no, I can't do this. I got to go. She was counting down the days. She literally would tell me every day she was counting down the days. So it all just depends. But for sure, it is a lot easier for new grads to get it's a lot easier for new grads to get jobs because they're funneling you into a residency program. My problem is content. Okay. So if your problem is content, I would definitely recommend starting with the hardest section that you have the problem with, and incorporating questions, and then going all the way through. Hey, and if you are looking for like one-on-one tutoring, you can check my link out for one-on-one tutoring and coaching. Okay. You can check that out as well. The nurse residency program is a joke. I agree. Because the nurse residency program that I went through, even though I had already had 6 months of nursing experience, they didn't count it because I was active duty at the time. It was 10 to 12 weeks. And then they were like, all right, here you go. And I'm just like, so you're going to leave me out here on this ICU when I'm asking all these questions about the acuity of patients that I haven't experienced before. Okay, fine. And so like my next 7, 8 months was just like, it was crazy. It was crazy, which is why I always tell everybody, don't let people play with your license. Don't let them do it. Still struggling to pass the NCLEX. Please help. If you need help passing NCLEX, and if you're looking for one-on-one tutoring, check out my link in my bio. Once you click the link, you'll see where it says NCLEX one-on-one tutoring, and then you'll click on that link and it'll take you there. An egg? What about an egg? Oh, it's already 7:30. All right. Okay. Yeah. So who says? It says I'm in an LPN program now, and you are giving me so much inspiration. I'm so excited, Ebony. I'm just letting you know. Stay excited. Like you're gonna hit those roadblocks that are gonna be so annoying. You're gonna be so stressed out. Right. But I'm telling you right now, once you get into school mode, time management. All right. Yeah, everybody ever heard the term a closed mouth doesn't get fed, right? You gotta reach out. You gotta ask questions, get into a study group. Okay. Get into a study group, you and 3 other people. 25% of the work you can reap 100% of the benefits if you split it up correctly, or if you split it up evenly. All right. So think about that. An egg, amen. Do not let them play with your license because somebody tried to play with mine. Look, people try to play with mine all the time, and I don't play that. Struggling, especially with next gen. Okay. Like I said, the next gen is all about how the questions are delivered to you. The content itself hasn't changed. Watching for the first time. What is the easiest route to become an RN? There is no easy route to become an RN, Bree. There is not. To become an RN, there is no such thing as easy. You have to put in the work. So you need to figure out what school you want to go to, the prerequisites, the entry exams. You got to get accepted into the school, go to school, and then the real fun begins when you start school. All right. So I'm telling you, there's no such thing as an easy route to become an RN. And trust me, you don't. And let me tell you something. When you become an RN, you would never want anybody to come up to you and be like, man, you know what? Nursing school was easy. Like, I didn't have to do all of this and blah, 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 blah. I just, like a nurse, especially like all nurses that know the struggle of being a nurse, they're going to look at you and be like, how in the hell did you become a nurse when, it's just stuff like that. So think about it. Think about that. Like literal obsession. It is literally, you literally have to be obsessed. The only way I've been able to be successful in nursing school is to make it my number one priority. It is facts. You have to be obsessed with it. I just finished my BCS in midwifery in another country, but I want to be an RN here. So to be a midwife here, yeah, you have to get your RN, and it's difficult. School is hard. It's hard, and that's not no shade on, you getting your midwifery in another country, because I know you worked hard for that as well. But to get it here, it is definitely, they make it more, the credentials are different and they make it more difficult. All right. So you have to go through the same process that everybody else had to go through, unfortunately. And then once you do that, to be a midwife here in the United States, I believe it's a master level degree. Like you have to go to another program, unless those programs will take, what you've done from another country. Okay. But that will require tons of research on your part. All right. All right, ladies and gentlemen, that would be it for the stream today. I appreciate everybody coming by and hanging out with me, even though you're welcome. Even though, we only got 34 people in here, but 34 people is better than zero. But then again, if it's better than zero, don't matter. Somebody else is eventually going to see this. So another last tidbit from me, 7-day NCLEX course. It is in its pre-launch phase. I have 42 videos up there with more coming. It is $48. You get it for a lifetime. That is the bonus that I'm giving people for being early adopters. Okay. Go check that out. If you need one-on-one coaching at all, check that link out in my bio. It is also there, and it'll take you there. All I do is ask for your email. That way you guys can get access to the page and all that good jazz, and then we'll be good to go. Okay. If that is something that you are interested in. And last thing, love yourself. Love yourself. Take care of yourself. Okay. Because you only got one you. And I know Stephanie's been here enough to where she's heard me say this, right? You only got one you. Okay. Because if you can't take care of you, you can't take care of no spouse. You can't take care of no parents. You can't take care of them badass kids. Why? Because fuck them kids. I'm just playing. I love my kids. I'm just letting y'all know that right now. But in all reality, you have to take care of yourself. Do what you need to do for yourself. Prioritize yourself. If you're in school, make school number one priority. Everything secondary. Of course, things that are important. Of course, your children and your family, their well-being, stuff like that. So make sure you do that. Remember, listen to me when I tell you, if you fail that exam, I don't care. And by me saying I don't care, I'm saying, okay, cool, you failed it. Now, what are you about to do? You were unsuccessful. Now, what are you going to do to be successful? All right. So I appreciate everybody being here. I love each and every one of y'all for y'all bringing the energy and asking these questions. And until then, did you say badass? I did say badass kid, because these kids bad as hell. I'm telling you right now. So, but yeah. And I will see everybody on Wednesday. Bye.